Right. Very good morning, guys. After a few days, very good morning. So, really happy to see some faces. And so, first of all, I would like to congratulate my students who got through this time Erpm exams, and they are waiting, to become complete doctor. They are already complete doctors. They are waiting for their internship. So the thing is, guys, so today we are going to discuss about how to pass the Erpm exams easily, right? So, and discussing the tricks, right? So the thing is, actually, there are so many myths are there among among of y'all. So the thing is, they most of the time they believe the exams are very difficult, right? It's not true. So exams are not difficult, right? So that's the reality. So I will tell you how to pass the exams easily, and also I will explain how to get more marks or very high marks in your exams, right? So today, guys, I want to share a few things. Guys, so today we are going to discuss how to pass the Erpm exams easily. So so during this session, so I'm going to discuss about a little bit about the Erpm exams and Erpm pediatric structure a little bit, and then a little bit about success stories, right? So then you will have an idea how did they study and how did they got through in the exams very easily, right? So then, of course, I will talk about a little bit about how to pass the part A or the theory exams or the MCQ and the SPA exam, the SPA paper, and also a little bit about the part B and C, right? I will give a rough summary regarding the part B and C. So how to pass the exam as well as how to get more marks. So also I will discuss how to score high marks if you are targeting for a rank. So how to score a high mark in your part A as well as in the part B. Then also we are going to discuss some SBA questions as well as I gave a paper yesterday. So there are some questions are there. So we will discuss some questions where you will have an idea how to tackle those questions. Those are a little bit tricky, right? So even your exam paper, it's not so pretty obvious, right? Sometimes it can be very tricky. So the thing is how to tackle those questions and SBA tricks. So we are going to discuss about that as well. So thing is, guys, so finally I will tell you how to study for your exam. So the thing is that's also very important. So keep this in your mind, guys. Again, it's very important, guys. Again, I will tell you. So those who joined today's class, I will provide you a link, right? So you can fill that Google form. So then you can have the access for the free lecture of multi-inflammatory systemic disorder following COVID-19. So it's very important current topic. Next time it can be there in your papers as well. So these days it's right, the prevalence is so high. Even yesterday, last night also, I had to go to the hospital, Jayawardhanpur hospital again. Today morning also, before this session, I went to the hospital because the one child got very bad, right? So the blood pressure suddenly started dropping right after developing myocarditis, right? So then I had to manage and right again came. So again, it's a very important current topic. So you should have a very clear idea. So those who join today's class can have the free access. And also, guys, please fill the Google form. So the thing is, once I provide it, so the thing is again, so your exams, theory exams will be on December. So this month, of course, I'm discussing, so these due to this current COVID situation, most of you all have economical issues as well. So thing is, weekly I will be discussing a paper, questions paper. So where it will be free for you all. So you all can join for that paper as well, paper class as well, right? So keep that in your mind. So thing is, guys, so today's lecture. So the first of all, have an idea. So what is Erpm, guys? So it's an examination for the registration to practice medicine in Sri Lanka for the foreign medical graduates, right? So thing is, guys, so those who graduated abroad, so it's a exam which has created to practice in Sri Lanka. So what do they expect from you all actually? So what's the purpose of conducting this Erpm? So keep this in your mind, guys. So keep this very clearly in your mind. We want good house officers, house officers, house officers. So this is a health system. So keep this in your mind. So we don't want. So this exam is not for nurses or attendants. We want good house officers. So you are going to become a doctor, right? So we want good house officers. But keep this in your mind. We don't want consultants here. This is not an exam for registrars, senior registrars, or consultants. So this is about undergrad. Everything is about undergraduate level. So you don't study unnecessary stuff. So you need to study necessary things, and you need to identify what are the unnecessary things as well. Just don't study the whole Nelson, right? Keep that in your mind. Again, just know what is necessary and what is not. So thing is, all the Erpm teachers will guide you all. So what is necessary and not. So again, guys, so what do they assess in your exams? So thing is, guys, one important thing is core knowledge of clinical facts related to common conditions seen in Sri Lankan hospital setup. So keep that in your mind. So thing is, clinical facts related to common condition. So thing is, guys, so you must have learned. So when we are discussing about hyperchromic microcytic anemia, we discuss about thalassemia, we tell about thalassemia, iron deficiency anemia, and also as example, sideroblastic anemia and the lead poisoning also comes under hyperchromic microcytic anemia. But do we ask questions? Do we put an MCQ regarding sideroblastic anemia in your exam paper? No, and never. So thing is, those things will ask in your postgraduate exams, but not in your undergraduate level, because those things are not so common in the hospital setup in Sri Lanka. Even the cystic fibrosis, sometimes you must have seen in abroad. So it's very common in Europe, but it's not a very favorite question in pediatrics in Sri Lankan setup, because it's not so common. It's an autosomal recessive condition where the gene is more expressed gene is more seen in among European people. So thing is, guys, so keep that in your mind. So we are assessing the clinical knowledge, so core knowledge of the clinical facts related to common conditions in Sri Lankan hospital setup. So again, we are mainly assessing that fact, mainly during your MCQs as well as in your long cases. So we will never give uncommon cases in your long cases as well. We are giving very common case which you see in your day-to-day life. Right, very common febrile convulsions, dysentery, nephrotic syndrome. Right, we hardly give an uncommon condition. So we never give an uncommon condition. So we always give common conditions. So keep that in your mind. Don't study unnecessary stuff. So again, guys, it's not about the everything, right? You need to know what is necessary for your undergraduate level. So the thing is, guys, again, it's very important. We are assessing the clinical reasoning, the clinical critical thinking, and the decision making. So it is mainly assessed in your SBA paper, or the single best response question paper. So it is, again, we are assessing that knowledge, and also, guys, we are assessing during your short cases as well as in your emergency or the part C component as well, right? So keep that in your mind. So you should have a very good brain to right, and right, so that is my main I am mainly focusing on that part to improve, because if you score in those things, you can easily pass in your exams. Again, the patient caring also very important. Again, it is mainly assessing your short cases and long cases. So if you don't, so these days it's very lacking in the medical setup. So if you don't say good morning, if you don't thank, if you don't smile, right, the smile is smiling with patients, and also the decent smile with the examiner is very important, right? So if you don't do that, right, if you right, so if you don't breathe the patient, so again they will reduce your marks. We are very concerned about those things as well. Those things will be assessed during your short as well as the long cases. So the thing is, guys, so before quickly, if I discuss about the Erpm structure, I think you all are well aware about this Erpm structure. So you know there is a theory exams as well as the Viva exam is there. So theory, of course, there is a part A and the part D is there. Part D, of course, mainly the forensic and the community medicine is there. And there is a new component, which is psychiatry, which is an independent thing. So again, you will get 30 MCQs you need to score. But we are mainly worrying about the part A component. So there is a separate medical track as well as a surgical track also there. So the medical track, right, if you want to enter to the Viva, the medical track in the Viva. So thing is, you need to get through in both medicine as well as in the pediatrics as well. So we will be we are providing a MCQ as a SBA paper, so which consists of 25 MCQs as well as 25 SBS. So if you score high marks, more than 45% each, and the average of 50%, so I will explain it later. You will be eligible to go to the medical track of the Viva stream. So again, the Viva, of course, again, it's again, there is some two components are there. One is part B and the other one is part C. So the part B again, mainly we are assessing your short cases as the long cases skills, and the part C we are mainly assessing your these emergency management knowledge. So you should have a very clear idea about the Erpm structure. So the psychiatric component is new to you all. So those who couldn't get through this part A previously, they need to sit for this psychiatric exam as well. So the thing is, guys, so quickly if I discuss about this Erpm pediatric structure, pediatric exam structure, again the part A, guys, so you are getting MCQs and the SBA papers. You are they are providing 2.5 hours for that. So keep this in your mind, guys. So you are getting 25 MCQs and the 25 SBR questions. So thing is, guys, so each question will carry 5 marks, right? So thing is, the total marks are 250. To pass the exams, you need to score only 45% or the 112.5. So that is less than the 50%. So keep that in your mind. So people are sometimes telling the Erpm exams are so difficult, but the reality is, guys, you need to score even less than 50%. Right, so usually the community, right, they expect you all to have 100% knowledge. So they used to tell, doctor right? So they think that you have knowledge about everything, but the reality in your exam setup, we don't expect in such way. We expect only less 45%, which is less than 50% also. So it's not a difficult task to pass in Erpm part 1. It's a very easy. I will let you know. So guys, again, the part B, again, you are getting long cases and short cases. So the long case you are getting 20 minutes, and each short case you are getting 2 short cases. So each short case you are getting 10 minutes, right? So altogether there are 20 minutes. So in long cases also you need to score more than 45, and the short cases also you need to score more than 45. But your total mark should be more than 50%. So thing is, guys, for example, if you score 45 marks in long cases, how much do you need to score in your short cases? So you need to score minimum of 55, right? Otherwise, you will not be able to pass the exam. So make sure you never target for the 45, then you will end up in 30s. So you always target for the 90s. So if you make a mistake or if the examiners are tough, so you will end up in 70s at least. So my target is to actually to build up to score 90s, not just the pass mark. So keep that in your mind. So the thing is, guys, the other important thing is the emergency. Again, in the pediatric emergencies and the medicine emergencies, you need to score more than 50%. So the thing is, guys, again, it's very important. If you learn the pediatric the medicine emergencies very well, so if you perform in at least in one particular emergency, then again other examiner will get stimulated to give more marks, right? Keep that in your mind. So there were so many examples there. So students will keep on telling they couldn't perform in medicine, but they were able to perform extremely well in pediatrics. So the thing is, then the examiners will have a positive idea about so then they will put more marks. So keep that in your mind. So the thing is, guys, quickly, if I discuss a little bit about common myths related to the Erpm exam. So the thing is, guys, the first important thing is what? So regarding part A or the theory exam, so thing is, guys, so keep this in your mind. Most of the students think that part A theory exam is very difficult. No, it's not. So keep that in your mind, guys. It's very easy. You need to score more than 45. You don't need to score even 50 marks. So if I give you an example, last time there's a huge batch because they were waiting for more than 2 years. So the thing is, guys, there were more than 100 students, were the regular 100 students were there in my theory class, and only one student got failed in the exams. Right, rest of them got through in their theory exams in pediatrics. So keep that in your mind. It's not a difficult thing. So if you get a proper guidance, you will easily pass in your exams. And also, guys, so most of the time you think if you do more questions, you will get more marks. So that's also a very common myth, guys. So thing is, those days, of course, those days, of course, the 20% of the questions were previous questions which got overlapped. But nowadays, the examiners know the students are recalling the questions and the students have past papers. So usually they don't put the same questions again and again. So what they do is they always put new questions. So you must have seen last time exam, almost all the questions were very new. But luckily, my students were very happy. I did so many papers and questions. But the thing is, more than that, I trained them for the concepts. So keep that in your mind. So it's not about the number of questions. If you by heart the same questions and questions again, so there is a high chance of getting false or mark the incorrect answer, especially in your SBA paper, right, in your exams, because you will get preoccupied. So make sure you learn the concepts and you learn the proper sequence correctly. So then you will be able to mark very correctly. So you will learn at the end of this lecture. So when we are discussing these questions. So again, guys, the other important thing is, guys, so people think that if you be less greedy when marking MCQs, you can get very good marks. So guys, again, I want to tell you, so thing is the most important factor, right, which decide whether you're passing or not and whether you are getting high marks or not is what? Guys, it's totally about SBAs, and it's SBAs. So it assesses your memory capacity, and that's why we are getting 5 marks for each single best response question. So the thing is, guys, if we consider 2 people, one person might mark 4 stems, all 5 stems, but he marked 2 stems incorrectly. So overall, he will get only 3 marks. And another person, he might mark very carefully, and he might again mark 3 stems correctly. So there won't be any difference between those 2 people, those 2 students. But the important thing is, guys, in your SBS, if you train if you train a lot in your SBS, so sometimes if you train a lot, you can score around 20, 22, something like that. If you score around 22 SBAs, right, in your paper, and if your friends score around 10 SBAs correctly, so there will be a 50 marks gap will be there overall, right? So keep that in your mind. So that's why, guys, so even how much, even we don't like to tell those things. So most of the time we have seen even the medical faculty, local medical faculty. So the most of the students who are within first 100 are from Colombo medical faculty who had the high marks in the A-levels. So thing is, guys, the SBAs are mainly to assess the thinking capacity. But the important thing is, guys, it can be improved a lot. It can be improved. So last time, most of my students were able to score more, almost all the students were able to score more than 18 out of 25 SBAs. So then of course, if you mark 18 SBAs correctly, then you need to score around 12.5 MCQs, right, out of 125 steps. So it's a very small amount. So that's why keep this in your mind, guys. So you need to focus on SBAs. Then you can have a very high marks, as well as you can pass. Like getting failed in your exams is inevitable. So the thing is, guys, then the Viva again, guys. So most of the times again, the MCQs, guys, so the thing is, it depends on your capacity. So if you are very smart and if you have studied everything so correctly, sometimes you might be able to mark, right, So you might be able to mark almost everything, right? It depends on about your capacity. So I can remember when I did my final MBBS, so I had the highest marks ever in history. So SBS, I got 30 out of 30. So local faculties, we are getting 30 SBS. So I got 30 out of 30. And the MCQs, we are getting 20 MCQs. So that is overall 100. So I didn't mark only one stem, except that I got correct in all the rest of the stems. Right? So the thing is, it depends on your capacity, right? So you all can score very well. So the thing is, definitely, if you learn everything correctly, and we are guiding you all, so it would be very easy for you all to get very high marks or the 90s, right? 90s in your exam. So the Viva part. So the thing is, guys, again, most of the time students think that part B and the C exams are very difficult. So, right, you will understand one, like a few students are waiting to share their experiences. So you will understand whether it is easy or difficult, right? Right. So then, of course, but anyway, you need to study and you need to work hard, definitely. But if you get the proper guidance and if you study everything what is there, it's not a big deal, right? So again, guys, you think that you are weak in clinicals because you had less clinical exposure, right, during the faculty time. So most of the time you used to say they don't the Chinese medical graduates, they think that our accent is different, so right, so they are not allowing us to examine the patient, so we had a poor clinical exposure, right? Most of the foreign graduates, they think that, but keep this in your mind. That's the one of the biggest myth among y'all. So sometimes the seniors, sometimes even the PA teachers also used to say, no, that's wrong. So the thing is, most of the time, almost always, 99% of the time, students get failed not due to this clinical problem, because they are lack in their knowledge regarding the clinical facts. How to tell in the short cases, how to come to a conclusion, how to narrow down the conclusion, how to tell the differential diagnosis correctly, right? Rationally, everything. So that's the main problem. Even in the long cases, there are so many components of your assessing: the communication skills, the presentation skills, the complete diagnosis, right? And the discussion, everything. So it's everything about the theory knowledge, right? Not mainly about the clinical exposure, but the practicals are very important to polish your knowledge, and you can, right, polish your knowledge, not to pass your exams. So you get failed in your exams because of your lack of the theory knowledge related to the clinicals. But the thing is, if you get the proper practical exposure, you can score very high marks. If you have on like that, if you do practicals on top of with a very good clinical knowledge, you can score very high marks. So keep that in your mind. So thing is, guys, so you have seen enough patients, more than I have seen during my medical career. When I was sorry, not the medical career, when I was during my when I was a medical student. So thing is, guys, in your medicine case, I had a lymphoma where I saw in my GI case for the first time in my exam. So the empyema, I got an empyema in the respiratory. That also wasn't first time. Then again, the CVS, these aortic regurgitation with an Marfan syndrome. I have listened to several aortic these early diastolic murmurs, but I haven't seen Marfans previously. But you have seen enough Marfans during my practical session, right? You have seen everything. So in my this is related to medicine. Then again, in CNS, I had a spinal shock. Again, that was my first clinical exposure. But again, I was very well thorough with my theory knowledge. So I was able to work out everything. I was able to score very high marks. So thing is, guys, so again, the pediatrics also same. So I had a complex storage disease condition, right? Again, they were shocked. They thought their case has been leaked. Then, but luckily I was able to rationalize everything. So the thing is, then they got to know. Then again, the trisomy 21 is cyanotic AV canal defect. So that was my pediatric short case. Right. Again, the long case, I got an complex febrile convulsion following acute invasive diarrhea. So they asked everything, right? Because I was able to answer everything so quickly, nicely. So they asked everything related to febrile convulsion, status epilepsy. Then of course they asked regarding dysentery. Then of course they asked regarding Shigella, subtypes, the toxins, everything. So keep that in your mind. So if you perform very well, so they will ask advanced questions to give more and more marks. So you all will be able to score 90s if you get an proper guidance. So keep that in your mind. So it's very hard to get failed in your exams. So I was keep on telling the students. Some students actually say we were unlucky during the exam. So again, guys, so keep that in your mind. That's not the most of the time. That's not the reason, right? So thing is, guys, if I go to the exams tomorrow even, do I get failed? No, most of the time I will get the maximum. So the one reason is, guys, so everything is there in my tip of the tongue, so I can tell everything rational. So the thing is, if you also train like that, it's not the acute memory. If you practice persistent, right? It's about the chronic memory. So if you keep on practicing and if you live with that particular subject, it's nothing at all. So keep that in your mind. So the thing is, guys, it's very hard to get fail in your exams. I was keep on telling the students. So I don't know the people who did swimming during your school life, I think they are well aware. So I'm a Josephine. I was there in the swimming squad. So what I saw was, so thing is, it's very difficult to get drowned. So have you covered pool එක බහලා තියෙනවද? ගිලෙන්න try කරලා තියෙනවද? ළමයි ගිලෙන්න try කරොත් ළමයි එන්න උඩට තල්ලු කරනවා. Right? So exams are also like that. It's very difficult to get failed because we all want to pass y'all. So examiners are very supportive. They all supports y'all. So they want to pass y'all. හැබැයි වතුරේදී ගිලෙන්න කොච්චර අමාරු වුණත් කට්ටිය ගිලෙනවද? Oh. Right? So same in your exam. So it's very difficult to get failed in your exams, but sometimes students get failed. So keep that in your mind. So that's the thing. So the reality is, guys, so the ERPM exams are very easy, and the pediatrics are easy. So my experience is pediatrics is extremely easy. So the thing is, guys, before moving to the about questions and the rest of the things, I would like to share a few experiences of few students. So what are the exam tips, and how did they study the pediatrics, and how did they improve? So then you also will have an idea regarding how did they perform. So so who want to tell first? Arunathina, are you there? Richie, you want to tell? Who wants to talk first? Right. Okay, Richie. So can you give a small brief introduction about you and?
Yeah. Good morning, everybody. Thank you, sir, for giving me opportunity to come and speak on behalf for all the students. My name is Charles Anderson. Maybe most of the students must be knowing me. I'm from Vitebsk State Medical University, Belarus. And to speak about ERPM exam, first and foremost, I want to thank Ruanka sir for showing me the correct pathway of what is ERPM examination and how easy it is to get through. First and foremost, I want to tell all the juniors and whoever is present there that just you need to understand that this exam is not hard. Just people make it complicated for their benefit. It's just being honest with all the students. So first, you need to understand that this is an exam which is possible. If I got through, anybody can get through. That's what I believe. So, but to get through the exam, you need the proper guidance. If you follow the wrong mentor, you will fail. That's inevitable. So you need the proper guidance. And as sir explained earlier, when you go for the exams, if you answer unwanted things, they will definitely fail. You need to answer things rationally. Rationally means up to the point. They expect that. When I went for the exam, I've been doing the exam pediatrics twice. So on my first attempt, like they just told me, Puta, you're not rational. So after I attended Dr. Sir's classes, I understood this is what they want. So these are the things what they want, and this is what we need to answer. So there's nothing much to study. There's nothing to read. Just follow Sir's notes and just follow what Sir has to tell, and you go for all the classes regularly. Then these exams are not. For me, it was not difficult at all. For me, it was like just regular day going for the exam and coming back. So what I need to share with you all is, you have firstly, before you start your your Erpm journey, you need to go for classes. Means go for teachers who you understand. If you don't understand the class, don't go with the herd. Crowd එකත් එක්ක යන්න එපා. That's තේරුම් ගන්න. ඔයා crowd එක follow කරොත් you will end up with nothing. So always follow if you understand. First go to the class and understand whether you can understand this teacher, whether what he's saying is it going to my head, and whether this is facts or fiction. Then you follow through. And next thing is, as Sir mentioned about MCQs and SPAs, this is something which you need to understand, which is something you need to have the proper knowledge, have the proper points, and you need to practice as well. So coming to the Viva, I don't want to spend so much time on this. Coming to the Viva component, patient exposure is number one. So I need to thank Dr. Ruanka sir, because with Sir, I had the personal opportunity to go and see all the cases in the sense CVS. I've been seeing, to be honest with everybody, more than 20 to 30 patients. I think Sir will agree with me. CNS or everything which then thalassemia unit, everything, then splenomegaly, everything. So going to the exam, for me, my cases were CVS, and I just saw the patient from far and I told the diagnosis, because Sir taught me, when you look at the patient from far away itself, when you look at these points, you can come into the conclusion. So the consultants were like shocked when I was like answering. So I need to thank Sir, and I trust all of y'all in the correct thing, and I appreciate everybody coming online and listening to Sir, and following through. And I believe that everybody will follow through Sir's advice and become successful. So like this exam is it's nothing hard, and it's not anything difficult. And please understand, you need to invest properly in your education, in your Erpm. So if you don't invest properly, if you invest on the wrong people, you will get the wrong results. So make sure that you invest properly. Now I made my investment properly, so I passed. I am going through my internship. So make sure that you don't follow the herd. You invest properly in your education, and if you invest properly in your proper teachers, where you get your results and push through. Because our goal is to pass this exam. Our goal is to pass this exam. End of the day. So if you invest if you invest wrongly, and because then I don't think you will go into the you won't get your results. So I thank Sir for giving me opportunity.
Thank you very much, Richie, for sharing your experiences with us, and also I'm wishing you all the best for your very bright future. So be a kind-hearted doctor. So I will.
Thank you, sir.
I will have an. Can someone also speak again? Does anyone wants to speak?
Yes, sir. I am here.
Yes. Hello, Tushar. Yes. Mohammed.
Yes, sir. So, මාත් වචනයක් දෙයක් කියන්න හැදුවේ සර් ළමයිට. කමක් නැහැ.
කමක් නැහැ කියන්න. Welcome.
හරි සර්. I will speak in English for students who speak Tamil, Sinhala and English.
What comfortable විදිහකට කියන්න. It's okay. ID game ප්‍රශ්නයක් නැහැ. Right.
Oh, and foremost, I would like to thank Dr. Ruanka for his marvelous support for my success. When I was struggling for the exam, over years, I met Ruanka sir. He gives me personal attention and rectify my mistakes. This is how I achieve. This win after many years, I completed all Erpm. His teaching skill, especially customized into different student and different knowledge level. Highly appreciated. Thank you very much, dear sir and my dear colleague. Sir, සිංහලෙන් කියනවා නම් sir, බොක්කෙමයි කියන්නේ. So මට හම්බුනේ sir, වයිවා ක්ලාස් එකකදී. එතනදී මම ලොකු වෙනසක් දැක්කා. අනිත් ක්ලාස් වලටත් මම ගිහිල්ලා තියෙනවා. මේ කියන්නේ sir තමයි එතනින් මට ඉගෙනුවේ attractive history taking component එක. So ඒ කියන්නේ pediatric වල ඒ කියන්නේ child plus mothers at least both two component තියෙනවනේ sir. ඒකෙදි කොහොමද history එකක් ගන්නෙ? කොහොමද
handle කරේ නෑනේ නේද?
ඊට පස්සේ සර් මම ඒක ප්‍රැක්ටිස් කරා විභාගෙට යනකම්ම සර් කිව්වා තුෂාර ඔයා පොඩ්ඩක් දුර්වල ළමයෙක් ඔයාට ස්පෙෂල් ඇටෙන්ෂන් එකක් ඕන එන්න හොස්පිටල් එකට ජයවර්ධනපුරට එන්න පුළුවන්ද කියලා. මම සර් කිසිම ලැජ්ජාවක් නැතුව සර් බයක් නැතුව සර් මම ඇවිල්ලා සර් එක්කලා පස්සෙම ගිහිල්ලා සර් කියන විදිහට මේවා කරලා සර් විභාගෙට ඉදිරිපත් වුණා. සර් කිසිම ප්‍රශ්නයක් වුණේ නැහැ විභාගෙ. සර් කිව්වට වඩා කිසිම දෙයක් එතන නැහැවෙත් නැහැ. සර්ට මම ආයෙත් තෑන්ක්ස් කරනවා. සර්ව ෆලෝ කරනවා නම් මේක කොට යන්න පුළුවන් ඕනම කෙනෙකුට. මම මේ අවුරුදු ගානක් try කරලා කොට ගියා නම් අනිත් ළමයිට අනිවාර්යයෙන්ම කොට යන්න පුළුවන්. Thank you very much for your all supports.
Thank you very much, Tushar, for sharing ideas. Again, I want to tell my students that the most important thing is, guys, so the thing is, there are good rankers are there, right, who got a very good rank, right? So the more than that, right, ඒ ළමයින්ගේ rank එකක් ගන්න ළමයාව මම ලොකුවට train කරන්න දෙයක් නැහැ. Right, keep that in your mind. So most of you all following the people who got very good ranks. I'm very happy about that. But my greater, I'm more happy, right, about students who were struggling to pass this exam, right, who were they are in this stuck for this pediatrics for years, right. ඒ අයව පාස් කරන එක තමයි ලොකුම satisfaction එක, right. So ඒක මතක තියාගන්න. බ්‍රයිට් ළමයා කොහොමත් මේවා ඒක ෆලෝ කරන එක නෙමෙයි තියෙන්නේ, right. මතක තුෂාරගේ හැංගිච්ච දේවල් ගොඩක් තිබ්බා, right. එයාගේ weak thank තිබ්බා. ඒ weak thank වලින් ගහලා යන්න පුළුවන් exam එක. ඒක තමයි අවුරුදු ගාණක් වෙලා තිබ්බේ. ඒකට ඒ weak එයාගේ strong තිබ්බ තැනක් තමයි මම notice කරේ සිංහලෙන් communication එක. මාර ලස්සනට he is talking very nicely, right. His Sinhala communication was very good. So thing is that in the long cases, of course, so there is a separate style is there, right? Active, interactive communication skills. So I improved that part a lot, and I asked him to, Anita, when they are presenting, tell everything, really, right? Related to shorties and everything. So no, stop, don't tell this, right? And I improved his this technique and the rest of things. So I gave the individual attention and I corrected everything. So one of my the biggest maybe the achievement in this time, right? And so really happy. So keep that in your mind. It's not about the smart students. So, but yes, I'm of course happy. But that is right. So thing is, anyone else who want to share their experiences? Yes, Gitu. Yes, sir.
Yes, sir. Good morning and good morning all the others. Yes. I am Arnodan. I am from Kanjan Medical University. So I got through this exam in my first attempt itself, and Ruanka sir played a huge part in that. So I should thank him for that. And so when it comes to part 1, so as sir said, SBAs are the most important out of all. So when you're going to study SBAs, it's all about when you make mistakes, you have to go back and see why you made those mistakes. There's no point of doing multiple SBAs again and again, or sitting and studying the same theory again and again. So when you make a mistake, it's like even though you do 10 SBAs, that doesn't matter. But then if you make 2 or 3 errors in that, you have to go back and you have to look why you made those errors. And sir's notes, when he says, when he does the theory classes and the paper classes, is perfect and is more than enough. So you have to write down every single points that he says. So he says quite quickly or fast, but then still you trace all the notes and you have to fill it up. because his notes are very precise and very important. If you are 100% okay with sir's note, then you will definitely score more than 75, 80. But then the way you get the knowledge out of the theory and how do you apply it to the SBA is your practice. So when you make a mistake, how often you go back and what they actually expect in the SBAs, and how can I get this knowledge from sir's note and how can I apply it to the SBA. That practice, the way you think, has to be corrected by doing it again and again. So when you do that only, you will get a self-confidence. So Hari, I got like 5 errors, 6 errors in that, but now I know why I made those errors. So the next time you will not make the same mistakes. So you will read it safely, the next management, the best management. So what is the examiner actually thinking? What is the common scenario? So you will start to think in a different way. So that will be helpful. So when it comes to Viva, again,
so what do you think about the SBA tricks program?
That is perfect, sir. So when it comes to the SBA tricks program, sir exactly says what you should know and how you should approach to the SBAs. So that itself will improve like from 15 to 20s or 15 to 23s. So if you attend that, you have to practice by yourself with that. If you attend that classes, it will be like very, you will understand the reality of how to approach SBAs, because many students, they sit and study, but then they have very good knowledge. If you ask, they know everything, but then they can't score high marks in SBA because it's not, they are not intelligent, or the intelligent fellows get 23, 24s. It's not like that. It's the way they think. Like Ruanka sir brings that out in the SBA tricks program. At the same time, we also have to work by going and referring the notes when we make the mistakes. So then just coming to listening to Ruanka's class itself is not going to give a good outcome. So we have to use the sir's knowledge and do a bit of a recap so that
how
it will
did
be
you
biased.
perform well in Viva? You had a very good rank, no? So how did you perform?
Viva, sir, it's all about sir. I mean, sir will give a right path to approach.
No, tell the honest things, huh?
No,
Honest.
yes, sir, yes. I had to start from where I started, and I'll end up where I end up.
Okay.
So in the theory classes, when we sit and study, first of all, the knowledge should be good. Without the knowledge, you can't pass Erpm. Okay, so sir gives a good knowledge. So we had to study that, and then even though you know everything, then comes the presentation skills and then examinations. Those can be done, but then you have to go to the hospitals and practice in front of sir. I know I was very good in asthma management and everything. Okay, and my first case I did in front of sir. My hands were shaking. I couldn't barely talk a word with sir. Okay, Gidu was there. He knows that as well. He saw that. Okay, and sir was saying, "Look at his hands are shaking." Okay, so if I didn't practice in front of him, then later on I realized having a good knowledge is not enough. You have to go and practice and get that confidence. So confidence is everything. So you have to practice in front of sir. It's hard, it's tough, because you might think that he might
yeah, I want to tell
score.
something to my students. So the thing is, guys, the thing is, he is one of my very good students. But the thing is, he's from Tianjin, so he's a very good, bright, smart student. But during my theory time also, he was very smart. Then of course, but during Viva also, he was very smart. But when he comes to the practicals or these hospitals, so when he's practicing under my guidance, so then of course I used to blackguard him. I scolded several times. No, so the thing is, even how smart he is. So sometimes we are seeing in an examiner's point of view. So thing is, keep that in your mind. Whatever subjects you try get the practice under the supervision of a professional or the Erpm teacher, right? So that's very important, because otherwise you will right. It's very important. So otherwise so practicing with your friends alone, it will not help you, right? Keep that in your mind. So Arunathan, do you want to add anything?
Yes, like practicing with friends is important, but then practicing in front of sir is very different. Like when you're talking with friends, it's like it's your colleagues. So then you will get a flow. So then you know that they are your equal. So then you won't have any restrictions. You will slowly talk nicely. But then when sir or when somebody who is superior to you, when they are looking at you, it's a different experience. So that experience we had to go through that multiple times to successfully do that in the exam. So like literally I would have practiced more than 15 to 20 times in front of sir in Jayavardanapura before I went into any exam. So just practicing, I did like for medicine, I only went to the medicine practicals, but not to the hospitals. But then sir gave a huge experience in the hospital. So that any subject, if you like experience very well in the hospital setup in front of a consultant or like a registrar, that confidence will spread throughout all the subjects. So like just
I
so
think it has indirectly affect your other subjects as
confidence.
well.
Yes.
Confidence, yes.
Confidence. So you have to like anybody can tell you are smart or anything, but then you should understand that you have the confidence. For that, you should prove to yourself. So for that, one thing is in Viva, you have to go and prove in front of sir that you can, then you will get your own confidence.
So really happy, Arunothan, for sharing your experience and everything. He's so wishing you all the best for a bright future and be a good, kind-hearted doctor. So again, anyone else to add anything? So Pasindu is there. Is Pasindu? Yeah.
Yes, sir.
Yes. Hello, Pasindu. So can you tell a quick introduction about you?
I'm Pasindu Prabodh. I'm from USTC Bangladesh. I would like to give some tips. Like everyone has told about studying about the exam. Like I would like to give.
His rank. Your rank is third, no? Yes. So he had a very good rank. So the initially, of course, actually his appearance, of course, like looking at him, like like so during the classes also, like, but he used to answer these difficult questions also, I noticed. But then of course I got to know at what point, can you remember? So I actually conduct an emergency exam at Japura. So in that exam, there were so many students there are more than 50 students there, and he had the highest marks out of everyone. So then I got to know so again, he must have a lot of experience. So the thing is the way he will advise regarding how he studied and everything. So quickly tell person what.
I would like to give a general approach to Erpms, like because our batch we had to suffer a lot during this period. We had to wait almost at least 2 years. And I would like to tell the future students like never get depressed, never be let down. Always like have the priority about the Erpm exam because if you pass the Erpm exam, you'll have a permanent job. So your main priority should be the Erpm exam, like the others said, and you should attend all theory classes and like.
So the thing is nowadays RHO salary is how much?
I don't know.
It's around 3 lakhs, right? So the thing is, if you get delayed in if you get delayed in 6 months, you're losing more than around 20 lakhs minimum, right? So if you calculate correctly, so it will be like around 50 lakhs. So make sure you pass in the one shot. Very good. So continue passing.
Yeah, so like during those 2 years, my main aim was to like somehow get through this exam in the first go. So like our theory exam got delayed by at least 1 year. So during the 1 year, I never let myself down. I always did the papers and also search papers as well. I like my way of studying was I wrote the answer at the bottom of the page when I first did the papers, and then the next when I like after about 2 weeks or 1 month, I would go like as if it's a new paper. I would like redo the paper again and think in different ways by just reading the first line. I would read again, and then I would think about the differential diagnosis, the investigations, so without reading the next part of the question. So like that, I attempted the SBA questions. Like in every attempt, I used to think in a different manner. when it comes to the Viva exam, I think sir has done a marvelous job to us, because I was not much confident in my pediatrics. And so sir's like the histories and the questions, I think it's always the same questions. Like the examiners, they like I got dengue as my long case, and it was the same questions what sir taught. Word to word, they ask the same questions from me. And like when it comes to Viva, I would like to add, like, it's all about adaptability. You should be able to adapt to the situation as quickly as possible. If you understand that the examiner is trying to tell you that your answer is wrong, you should accept it and like go forward like with what he suggests to you. And because in one of my short cases, like I did one wrong thing, but in the next short case, I somehow managed to come back. I mean, I come back strongly. So I think sir will guide you all very well in the short cases and the long cases with his great advice. I mean, patient handling, the tips and the tricks. I don't know, there was a lot what sir gave to me, and I used each and every one of them. I don't think I need to tell much more about sir, because all the others have mentioned that. You will understand as you all go along.
Very happy, Pasindu. And the other important thing is, when you get a very good rank, the advantage is you will get motivated, right, to do postgraduates, right? And that's the another advantage, right? So definitely he will do a postgraduate exam, and one day he will become a very good consultant. So that's something inevitable. So that's right. So he's a smart student, and again, the rank will motivate you all. So that's why it's very important to get through in the exams in the very first attempt, and as well as scoring a high mark. Again, make sure if you want to get through in the first, if you want to have a very good rank, definitely you need to get through in the first attempt. So make sure you balance all the subjects. So do not focus or do not use your full effort in a single subject. You need to balance all the subjects. Otherwise, you might pass and with a very high mark in a particular subject, and you can get failed in another subject. There were so many smart students there in my class also, very smart. Right? Some faculties, they were the batch tops. So again, they have referred in another subject. So the thing is, even they get through in the next exams, so they will not be able to get a very good rank, right? So that will be there. So this is Pasindu's very first attempt. So that's a very good news. Thank you very much, Pasindu, for sharing your experience, and definitely will have a very bright future. So wishing you all the best. So anything else anyone wants to add? Disuri, are you there?
Hello, sir. Yes.
Yes, Disuri. So yes. So can you tell me a quick introduction?
Yes, so hi, good morning, everyone. My name is Isuri, and I am from Shanghai Jiao University. Thank you, sir, for giving us this opportunity to share our experience with you all. So I have a few points that I jotted down that I wanted to tell you guys, the methods that I used to study. So one thing is, now since we have been doing Erpm for a long time, I had so many papers. So before the exam, before my theory, I took down an inventory of all the papers that I had, and I categorized them in according to priority. And I went through the papers rather than studying straight up theory. I went through the papers, and when I felt like there are questions that I'm not very familiar with, I went to the theory part and I went through the theory like that. So I think rather that approach helped me. I don't know if it will help everybody, but that's something that I practiced. And also while I was practicing all these papers, whenever I felt like I came across a part that I'm like you have to remember that point, but you can't. So I took down all those important points on a separate sheet of paper. And before the day of the exam, or like on the day of the exam, I went through that paper multiple times, so that points I can like quickly go through those points. So that is one thing I did.
The most important thing is, one of the important thing is, you must have, the thing is, you are a bright student, so you can work out. So the Aloganeyaneka, I don't advise that much. So the thing is, like if they change the question little bit, Alwangiyagama,
Yeah.
like I have seen lots of students, right? So thing is, for a smart student, they can work out. So the more important thing is you learn, the thing is you need to categorize, very important. It's categorization of the questions. And the thing is at the same time, the thing is the rationally think. So the rational thinking is very important.
Yeah.
Right? So then you are a
Yes,
smart
sir.
student. Of course, indirectly you are thinking rationally. Right? Okay.
No, sir. What I meant from Alavaganayanayaka, the say you want to remember a particular point about, say, sometimes.
Exactly.
Yeah,
So
yeah,
for
that point,
example, if
not
you say
memorizing
like the
questions.
infect fever and have a splenomegaly, you need to think about three things. Either whether it is whether it is infective endocarditis, typhoid, or right, infective cause with spleno, infective endocarditis, typhoid, or IMN. So those are the common ones. So if there's a cervical lymphadenopathy and the enlarged tonsils with palatal petechiae, that's about IMN. If there's an altered bowel habits, maybe an right hypochondrial pain, it is about typhoid. If it is due to, if they show some sort of, if they mention something about a significant murmur and maybe with an UFR, there's an red cells, glomerulonephritis part is going, that is about infective endocarditis. Like that, the key points, right? So that's very good.
Yeah.
So yes, you have remembered those key points. Very good. So anything else? What about the Viva?
Sir, my one advice is I have to tell these the future students not to study alone. I mean, that is one thing I did. I studied with a few friends, so it always helped, like discussing and like sometimes I used to teach them. I mean, for Viva, it's very important that we present to a senior to you or a senior doctor or anybody who's like who can actually guide you. But one thing I did was I used to teach my friends a lot. So that built up my confidence in a way. And in order to teach someone, you have to sort of familiarize yourself well with the subject. So I think that helped me. And my CVS case was VSD. The second one was
this teaching. When you said about the teaching part, I want to add. So Tushar, are you there? Are you there? Are you there, Tushar? No. So the thing is, again, the thing is, some students who came for the practicals actually, like they must have experienced that. So the thing is, teaching is very important. So the teaching actually, you will not forget any things. So the thing is, there were some students actually who didn't come for my routine classes, but they came to Japura to practice. Then of course, there's like they were shocked and wondering about these facts. They were not aware. Then they were asking, sir, then of course I asked them, you asked from Tushar. So in the then of course, so then he got motivated and he used to teach. So when the pretty girls comes there, I ask, Tushar, you teach? I asked them to call this. So that will motivate. So the thing is, yeah, that I think that was I think the like he was able so I think it helped a lot to Tushar also. So yes, Ishwari, so tell.
Yes, sir. So during Viva, it's very important to not to panic. So as it's like sometimes even if you make a mistake, you apologize and then you move on. Don't panic and sort of lose yourself in that moment, because examiners do understand that we are human, and we, even if you make a mistake, just apologize and move on. Because I did a big mistake in my neuro case, but then I apologized and I said, Madam, can I do it again? And then she gave me the opportunity. So just don't panic during Viva. And my long case was a UTI, and all the questions you gave in class, word to word, those were the steps, like in stepwise, they asked all those questions. So I want to thank you.
To ask from everyone, were there any single question in your long cases or in short cases, apart from my note? If anyone shows a single question apart from my note or which I didn't teach or, so I will refund the money, everything. Right? So it's something impossible. Right? Okay. So very good. Oh, yes. So really happy to Isuri. Yes, you want to add anything?
Sir, I pretty much it's sir.
Yeah, thanks a lot for sharing your experiences, Isuri. So wish you all the best. And you will be, again, you had a very good rank, no? So again, you will have a very bright future. One day you will become a very good consultant. So wishing you all the best for a bright future. So I will add, I will ask from one more student, only one more. So Kauda in Gitu, do you want to share? I think you were waiting, no? For long
yes, it's
time.
okay.
So, okay, yes. Can you tell a small introduction and tell about your experiences?
Nice. Hi guys, I'm Gitushan. Most of you guys might even know me. And first of all, thank you,
Seriously,
sir.
I thought you are famous. Really? Okay. Anyway, continue.
First of all, thank you so much, sir, like for everything. And guys, like I have very few tips and techniques which I use for myself. Okay, first of all, starting off, I know I have a rank and all that, but guys, like there's a side of me which a lot of you guys don't know about, which is I'm not this person who can sit down and study for a very long time at a stretch. And when I started off pediatrics, guys, like it was 2 years back, and I was in a class where, you know, like I was doing like 50 SBAs, and I got 10 SBAs. Like for like 3 or 4 papers, I got like 10 SBAs out of 50. That's how I started. And my pediatric knowledge was very, very bad, guys, to be honest. And then that's how I started. That's how I met Sir. I mean, I was one of the, I think, longest student with Sir, I think. And that's how I started, guys. And then I started like attending Sir's classes, and you know, like what I understood was, guys, like Erpm part A is the most important part of the entire Erpm. I'll tell you why. Because Erpm part A is when you get the theory right, you understand everything behind it. And guys, like to score well on Erpm part A, like I 100% agree with Sir. Okay, SPA is what decides your mark. Like you get your SPAs right, that's it. So focus on SPS. The reason why SPS, I mean, there's one very important thing Sir taught me, which I still remember to this day, is that when you get an SPA question, guys, it's usually a clinical scenario. Put yourself there. Just imagine what the SPA is like. Imagine the patient coming in. That will give you a lot of clues which you won't even think about. And that is something which I got from Sir and the Paediatrics program. And Sir gives a lot of shortcuts to getting the SPS right, which is amazing. But guys, like after you do the SPS, always, you know, remember the key point. Like remember, understand why they're asking that question. What do they want you to understand? What concept do they want you to know? Because these are very important, and these will like eventually help you in part B, part C, and everything, and in your entire career as well. Okay, so I mean, I don't have to go into the details about how to do Erpm part because I know Sir will cover everything, and his notes are spot on. Like I like the way it's like there are 5 pictures in one page, so that you just have to look at one page and then you have a whole picture of the entire disease. So which is amazing. And guys, like this is the technique I want to tell you guys. Okay, like for people who can't study like me,
Yeah,
for
you
like
like that? No. So the thing is, I usually
like
don't put pictures in the note much, and these research these things and the graphs and everything, because like if the note is very small, so you can have picture memory. Just looking like you can go through it like in seconds, the entire thing. So that's very good. So continue, Gitu.
Okay. So one technique which I use is if you are someone who can't study for more than an hour, like straight up. Okay, this is what I use, guys. What I use was is called. I use 2 things. One is called the Pomodoro technique. What you can do, use it to, you know, like maximize your study time. Or what it's like based on a behavior principle. What it does is like you start studying. All right, set around 25 minutes, like depending on how long you can concentrate. 25 minutes, and for those 25 minutes, like concentrate on what you're doing. Like study really thoroughly. Okay. Once that is done, take a 5 minutes break. Take a 5 minutes break. Okay. And then after the 5 minutes break, like in the 5 minutes break, do something fun. Do something like eat something nice, drink some tea, whatever. And then after the 5 minutes, start again. So that is one cycle. You do that again and again. Like with time, you will do like you can study for like 6-7 hours, like straight up, and you won't even feel tired. Like after you do 3-4 cycles, take a longer break, like half an hour break, 1 hour break. So
yeah,
that
because your subconscious mind works that you are getting a break. So during that, when you are working, you are concentrating as much as maximum. No, that's the reason. Very good. Yes.
Okay. So because that is very important, because I see a lot of people, they sit for 6 hours and then like after 1 hour, they are not even studying. They are not, the mind is not clear, and I don't know why they're sitting. It's like suffering. Like don't do that, because I was like, that's how I learned. Okay. So study little time, but maximize your time you study, and like put all your mind into it. All right. And learn it. And then guys, okay. And another thing I used is something called spaced repetition. thing is, guys, there's a lot to remember. Like there's medicine, there's pediatrics, there's surgery, there's genome, there's so much of things to remember.
And now there's psychiatry also.
Okay, guys. So it's impossible to remember everything. Okay. So what I do is when you look at it like that, it's a lot. But study daily, guys. Study daily, little bit. At least like every subject, like go back to like cardiology, like a particular topic, read it. And when you do it every day, okay, like after 30 days, you know 30 different topics. And that's a lot. So do that for every subject. So that is something called spaced repetition. Like everything you study, keep repeating it. Keep repeating it. It's hard, but keep repeating it. Like every day, every other day, just repeat it. Okay, what did I study 2 days back? What did I study 1 week back? And guys, like from like scoring 10 SPS out of 50, I was the person at the end of the class. I used to score more than 20, guys. And to be honest, like in my exam, like when you do your SPS and when you know you score more than 20, guys, like you know you passed the exam. Okay, because the MCQ, you just have to score a little more MCQs to get it through. All right. And once you study so hard, guys, and once you have come to that level, you know, then guys, MCQ, you know, even if you like when you are not sure whether it's true or false, like look at what your gut feeling says. Because after studying so much, what your gut feeling says is most likely right. So go for it. And don't be scared about MCQs. But SPS is very important, guys. It's really, really important. Focus on it really well. Get everything correct. If you go through the right process, there is no way you can get an SP wrong. So that is where you score your mark. That's about part A, guys. Now let's move on to part B and C. I'll do it very short so that I don't spend a lot of time. Part B, guys, for me personally, it was about practice. By the time you're done with part A, you should know your theory behind each and every disease. You should know it inside out. You should be so thorough with it. Part B, practice. Long case, okay, just sit down, okay? Asthma, what are the questions you're going to ask? Why are you asking each one of it? What are you trying to find from it? Okay, then after you do the history, like go for a summary on your own self. You know, it's multiple ways. Like first, you say the summary out. See what are you missing. Write your summary down. See what you're missing. How you can make it better. Then present it to a friend. See how you can make it better. Then present it to sir. Because what I see a lot of people do is they straight up go and talk to sir. And when sir corrects it, they're like, oh, okay, I made so much mistakes. Thing is, guys, when you go to sir, you should be like really good before you go to sir. So he can make you even better.
Yeah,
I think that's so because I see a lot of people who, you know, who go first time to the hospital and they try to palpate the abdomen. And that's not how you do it, guys. Like, first of all, at home, practice on a pillow. See, look at Sir's videos. He has amazing classes on Vivas, like spot on. Like, it makes you think. It tells you why you're doing what you're doing. So you know what you're doing. Practice it on a pillow. Go on an adult patient. Think he's maybe a child. Practice, because adults don't complain as much as kids, guys. And it's okay to hurt an adult, but not okay to hurt a child. So practice on a pillow, practice on the adult, then come back. Okay, now it's a child. I'm going to do it. And when you go for hospital, just practice it. And finally come and do it in front of sir. By the time you do it in front of sir, you should be good. So that sir will correct whatever you missed, and he will make you so much better, guys. So much better. And by the time you go for exams, you will be super confident. You'll be super, like, and thank you so much, sir, because like in my showcases, like I was really confident. I wasn't not even scared a bit, sir, and I know what I was doing. And one more thing, guys, this is another technique which I use. This is for cardiology, like especially with murmurs. A lot of guys have a problem. So I kind of have my stethoscope. I hope I won't take too much time. This is how you learn murmurs, guys. Sir's technique is amazing, but it's hard to go and listen to every murmur. So one thing you can do is take your stethoscope, put it in your hand. All right, this actually works. Okay, put the stethoscope in your ears and then tap. S1, S2, S1, S2. And then, guys, practice your murmur there. Practice your murmur there, S1, and drag it. Then you know it's an AR or AS. Practice it like there are YouTube videos on it. When you practice it like that, you know what the murmur is. Once you're thorough with it, go to adult medicine. Listen to the murmurs. Then come to a child. Because you can't learn on a child, guys. Because, I mean, children, it's very hard to get, I mean, clinical cases like that. And even in clinical cases, guys, there's so much of students coming in to see. So you get very little time. So make sure you do the best in that little time you get. And with that time, present it to sir. And sir will make you exceptionally good at it. Like, sir made me like so much good at like everything I was doing. Like, I was so confident in my exam, guys. Okay, so like, I'm not going to go into how to do it. I mean, Vivas, because sir will give an entire complete picture of how to do it and what not to do and what are the everything. So I'm not going to go into the theory part. I know sir will take care of it. Part C, guys. I mean, to be honest, for me, part C was one of the toughest. Because like I got a medicine long case, I mean, emergency of paracetamol poisoning. It was just a textbook type. I just had to say what was done. And then pediatrician was listening. And by the time I was done with medicine, he asked me like the hardest questions possible, guys. I mean, like he was going into neonatal like lethargy and neonatal hypoglycemia and everything, neonatal sepsis, all of that. The thing is, guys, what I understood was you have to be very thorough with your part A. You should know your theory at your fingertips. You should understand why you're doing everything. All right. Then part C, guys, it's a matter of practice. Emergencies, like sit at home, read, go through Sir's emergency note, see every single step, understand it inside out, understand it inside out. If you don't understand anything, you can call Sir anytime. Like I remember like messaging Sir late nights. I mean, Sir will take care of all of that. Like you don't have to worry about anything. Just drop Sir a message or after class, just stay and ask Sir. He will help you out. Understand it very well. Once you understand it, guys, it's easy. When you go to the exam, he just asks what you know and then you just answer it. And don't be scared. And it's a matter of practice. And emergencies, like since we don't get interaction with Sir, what I did was I used to sit with my friends and everyone will ask the question. Like, okay, let's say asthma, CV asthma, child with this CV asthma comes in. What am I going to do? And the others check with Sir's note. Am I going right with Sir's order? So that, guys, it's easier to remember. And emergencies, you have to be at your fingertips, guys. Because for me, they asked emergency for my loan case as well. And it will help you in your theory, it will help you in your vivas, it will help you in everything. So theory is very important. Master it, guys. Master it very well. Have everything in your fingertip. Rest of the other things is nothing. It's just practice, 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 practice. And Sir will guide you with everything. And for me, Sir is like he took me from a guy who scored 10 out of 50 SBS, who didn't know much of pediatrics, who was not at all confident in pediatrics, to a person who's like extremely confident. I'm not even scared about anything. Long case IVS, if I have to do it again, I will do it again. I'm not even scared. And all thanks to Sir. And I'm really confident I'll even pass again if I do it again. And so I'm to this level because of Sir. So thank you so much. I can never thank you enough, Sir. And guys, all the best. Study very hard and good luck for your future.
So really happy about you, Gitushan. So and also he was actually very smart guy actually. So so he actually even he said like he had a very low mark. So I noticed that it can be improved easily. So thing is he's a brainy person, but like thing is I think maybe he didn't get the proper guidance initially. So thing is after that he improved a lot. So thing is then I had no doubt about him. So I was so sure that he will get a very good rank in the exams. So I had no doubt about him. So thing is really happy about you, Gitushan, and I don't know whether you are like to do pediatrics in your postgraduate. So thing is, if you do, I will definitely help you, and also you will have a very bright future. And one day you can become a consultant, and also it's easy if you do pediatrics. So since you had a very good exposure theory and the vivas both, so you don't need to put much effort in PGs. So thing is, one day you can become a very good pediatrician. So really happy, Gitu. So wish you all the best for a bright future. So then I think we took a lot of time. So I will move to no. You guys discuss it. So thing is, it's very important. More than like mama kiyane ekak hariyane naha. So more than I'm telling, so the ideas of the other students are more important because they are the ones who sat for the exams very recently. I did my final MBBS long time back, right, years back. So thing is, that's why it's very important. So to share your experiences, though, then the other students also will get to know. So what is the reality and what do they like? They will have like the thing is, each of them will have different experiences and views, right? Ways of studying. So you all shared, right? So they were good rankers were there, rank 3, rank 5, So thing is, at the same time, average students were also there. So thing is, they also discuss. So it's very important. Hamom average neme man කියන්නේ hamom bright එක හැංගිලා තිබ්බ එකක් විතරයි. Right? So ඉතින් ඒක වැදගත් දේ rankers ලා කතා කරන අදහස් වලටත් වැඩිය අනිත් අය කතා කරන දේවල්. මොකද හැමෝම A level වලදී ලකුණු වැඩිපුර ගත්ත එක්කෙනා කියන්නේ ඉතින් පළවෙනියා වෙච්ච මම අතිරේක පන්ති ගියේ නෑ මම පාඩම් කළේ නෑ දවසට පැය දෙකයි පාඩම් something like that no right. So the thing is, it's very important, but keep that in mind. You think කවුරු හරි B කෙනෙක් pass වෙනවා කියන්නේ that's the biggest achievement. ඒ කියන්නේ ඕන කෙනෙක් pass වෙන්න පුළුවන්, right? I think that's very important. So really happy and thank you very much everyone for sharing your things. I will quickly move because we need to discuss few questions with the students also. And the thing is, I want to tell you, all the students, I have put a message, right, regarding the access. There is a link, right? Access for these. There's a link, so you can have access for the future. These papers, right? Free, right? The mixed type papers free of charge, as well as the lecture regarding MC, and also I will arrange few more important lectures also. You can have free access, and the papers are also free. So you can please fill that Google form. So it's there in the my coordinator Sudhira has uploaded to the Zoom chat. So please fill it, right? So good. So guys, if you want to ask any questions, Javi, do you want to add anything? I didn't notice you. So can you tell it now?
It's okay, no problem.
I didn't notice you.
Yeah, no issues. So I'm Javed. I'm from USTC, Bangladesh. So actually, I don't have anything else to add because I think Pasindu and everyone else, they are the top performers of the Erpm, and they have already told everything that you all need to know. So as a mid-range fellow, what I want to say is that me personally, for the year, I'll talk about Erpm part B and C. So I didn't go much to the hospital to see cases and all that. So all I did was Sir's mass practical class. This is me being honest with you. Sir's mass practical class, and also the periodical hospital appointments and hospital training that he gave us at Japura. So other than that, all what I did was listen to him very carefully. Whatever the things he teaches, like for example, even an incision, the location of incisions, anything that you can see for in a pediatric case. So those are the ones which I took it by heart, and I understood and I imagined it. So when I went to the exam, for example, for my loan case, I got a case for biliary atresia following a post-Kasaya procedure complicated with portal hypertension. I have never ever seen in my whole life. So I didn't panic at that time. So all what I heard was Sir's teaching, the Sir's lectures, that there will be a scar at this location, the baby will look jaundice. This is what. So I went there and
I was highlighting, and you were able to. It was nothing
exactly
for you.
Yeah. So I haven't seen that case anywhere. So like I told you, I have only gone to the mass practical, and I was not bothered going to these hospitals during the COVID time, and I was a bit lazy. So I am the person who always tries to find the shortcut. So I didn't go for the rank, and also in that case, so if you all want to go for the rank, you all can listen to them. But still, I don't advise you all.
So you also had a good rank, though?
No, I'm not advising you all to follow me. So that's what I'm saying. Like whatever Sir teachers, try to perceive everything. And there will be some times where you think, okay, this is not important. This point might not be important. In fact, everything is important because during my Viva, that point, so for my long case, so you see, Sir was telling that you will get common cases and all that for the long case and not to panic. Yes, that's true. But Sir will also teach you all the most common long cases to the least ones, which are very rare if you're kind of unlucky or something like that. So for my long case, I got a infected BP shunt. So I was like, is this a long
BP
case or a
shunt,
short?
yes.
Yeah, infected BP shunt. So I was confused as to what's happening. Am I in the correct room? Because they said I'm going for the long case and not for the short case. So but then I saw two examiners with the file, and then they told me to take the history. So the patient party was like, so mama baba aranga me VP shunt at that like infected. So then finally I had to talk with the patient and somehow get out, because I had to, Sir had given a criteria or like 20-25 cases which are possible. So I had to get that case somehow fixed into one of those so I can present it as a long case. So then I eventually understood that it's a case of meningitis, and my history went along with it. So again, same way, history in my lifetime, maybe I have taken twice or thrice. That's also when I came to Japura and Sir used to tell to take history, that's all. But the remaining time, all what I did was, Sir used to conduct these history taking classes. Like he used to bring live patients and inquire the patient's party and all about that. And he used to do it lively about the way and art of history taking. So that's all I used to attend, and the rest is all the theory note and all that. So I think that's all. You all just need to trust him, and the rest is all your hard work. And like everyone says, mostly it's the written part which is hard. In fact, for me, the Viva was a bit hard because I didn't fully focus on the written very well. So I didn't give my full attention. So if you're doing the written now, the part A, my advice is to, as Sarunodyan and Gitusha and everyone said, to fully focus on that, because it will really help you on the part B and C. And for the emergency cases, just go through whatever sir does. He'll take a 3-day class and then of emergency. And for us, our exams kept on postponing. So he even conducted extra classes just to, cement our knowledge. So I don't know. So for all that, sir, thank you very much. And I wish you guys all very best. And if there's anything, just post on the chat so we all could answers. And because you all should understand that this opportunity, I don't think you all can get, because sir is trying to organize, has organized this initiative of getting everyone who passed together and to give their opinions as well. So if there's any doubts for you all, make use of the opportunities and ask everyone who's here. And also, sir will also make sure to answer to any of your queries at any time. That's all. Wish you guys all the very best.
Thank you very much, Javed, and he's a very smart student. So, like he had like colleagues, no? So Dashan, Ahmad, these Bavindu, so all very nice people. So they actually worked hard. I noticed them. So thing is, you all will have a very bright future. So wishing you all the best for your bright future, and one day you will become a consultant. So the thing is, guys, do you want to ask any questions? No. So then, of course, quickly we'll move to what we discussed, right? So the thing is, guys, so just if I discuss with you also, finally the reality is everyone was telling us the Erpm is not difficult, it's easy, right? So keep that in your mind. So the thing is, guys, why it is important to get through in this Erpm in one shot? What's the importance? So thing is, guys, so you definitely can get a top rank in the merit list. So I can remember there were 2 girls there actually last time. One student were extremely smart and the other one was a little bit average. Both were TNG students. So that smart student, unfortunately, she got referred in surgical Viva. But that the other girl, her friend, right, got through. I think she must have taken average marks, but anyway, she got through in all 6 subjects. So now she has already finished her internship. Now she's in the RHO period, right? So, but the other girl just finished, and the thing is, even how much she is smart. So they were 120 first attempt students were there. So she was 123. So again, right? So you are unable to get a very good rank if you didn't get through in the first shot. So again, it's a very opportunity to select desired subject and the hospital during your internship and during your MO period. So thing is, guys, during your internship, sometimes you might get them somewhere close to Colombo. It's possible if you get an average rank even. But the thing is, post-intern, right? The MO period, actually, it's very difficult, right? To get right somewhere close to Colombo or somewhere close to Kandy. So you may need, right? So it's not easy. So unless you get a very good rank. So then, of course, you need to get through some postgraduate exam quickly. So it's not easy as you think. So the thing is, otherwise you may need to stay sometimes more than 4 years that particular hospital. So it's very important to get in the important to get through this Erpm exam in one shot. So again, it will motivate the postgraduate exams, as I mentioned, right? So and also it will you will get able to earn more money also, that as I mentioned. So the thing is, these RHO salaries around 3 lakhs. So the thing is, so you are going here and they are doing private practices. So the thing is, unless you have a significant economical issues, focus on the Erpm exams. Don't involve in unnecessary things, because you are getting a very small amount of money when you are working as a pre-intern, right? Keep that in your mind. So the thing is, right, so focus on your goal and make it accomplished. So thing is, guys, and it will avoid your social stigma as well. So sometimes, guys, so some people are very old, right? They are actually like මගේ වයස වගේ දෙගුණයක් විතර වෙනවා සමහරු. So it's right. I think in the ළමයි ඉතර දෙගුණයක් නැහැ කමාරක් විතර. So it's very sad. So sometimes like නැන්දම්මලා හිරිහැර කරනවා මාමන්ඩිලා හිරිහැර කරනවා තාම පාස් නැද්ද අල්ලපු ගෙදර ඇන්ටි අහනවා තාම පුතා පාස් නැද්ද, right? So it's a problematic thing, no? So it will affect psychologically as well. So make sure you, right? So you focus and get through. So there are some students who were with me in the past. Now they are doing their internships and some are doing their post-intern period. They are very happy. And the thing is, guys, so the thing is, right? So so this is about the pediatric exam structure. So the thing is, guys, I was keep on telling you all. So I told you all about the structure. So thing is, guys, how to pass the Erpm exam. So the part A, how to make a pass in. So the thing is, guys, so the easiest way is one. So the focusing on the SBAs. So that's the easiest way. As I mentioned previously, so MCQs, of course, yes, of course, it's important, especially if you want to score high marks. But the thing is, guys, it's very tricky. So MCQs, right? So the reality is when we are checking the papers, most of the times you will get a 2 out of 5, 3 out of 5, most of the questions. So the thing is, there won't be much difference, right? So that's why you need to focus on the SBS. So then you can score 5 like that. It's nothing, right? So that's why it's important. So I will tell you an example. So the thing is, guys, just in case, if you improve your knowledge and if you score 20 out of 25, so you can score 22, 23 even. 20 out of 25. So the thing is, guys, you are getting 100 out of 125. So to pass the exam, you need to get only 112.5. So then, of course, how much do you need to score? So only 12.5 out of 125 stems. So just roughly 13 stems out of 125. So just in case, if you score 22 marks, 22 SB is correct. If you score 23 marks, even you score 0 in your MCQs, still you will get through in your exams. So that's the tricky thing. So thing is, focus on the SBAs. So keep that in your mind. So, and also it will help you to get a very good rank. So assume that if you score 20 marks out of in your SBAs and MCQs 50%, that is something around 62.5. So then, of course, the average total, you will get 65% of the total mark. Right? So as Gitu also mentioned, so he was initially, right, around 10. He was scoring 10 out of 25. But later on, he was able to score very high marks, more than 18 definitely, right? So thing is, guys, so it's nothing, right? It's very important. Keep that in your mind. You can apply that to all the part A subjects or other part A subjects as well. So then, guys, how to score high marks in Erpm exam? So if you want to score 90s, of course, then of course it's a bit tricky. Then you have to have an important fact. So thing is, guys, keep this in your mind. In your exams, you have 7 subjects, and it will be continuous. Monday you have medicine, Tuesday you have surgery, the Wednesday you have genomes, and the Thursday you have pediatrics. So you have very limited time to study in the evening after coming from the exam. So you, right, you like the pediatric exam, I have forgotten, you will feel something like that. So keep that in your mind, like guys. So it's all about the chronic memory. So the chronic memory will not allow any on the back. So thing is, guys, so if you have a partial knowledge, so you will mark everything wrong. So keep that in your mind. So it's not easy to keep everything in your mind. So it's about the chronic memory. So the best way to learn is what? Learn everything rationally. Why it happens? What is this? It's like a story. So the medicine is story. I was keep on telling, especially the Catholic people know. දෙවියන් මං කියන්නේ මොකද්ද හැම වෙලේම දෙවියන් වහන්සේ මාවලා තියෙන්නේ medical students ලට පාඩම් කරන්න ආස හිතෙන්. So everything is so easy. Everything goes in a very methodical way. So it's very easy. If you know the concepts correctly, the basis, you can score definitely. Then of course the mastering the MCQ is also important. So a theory of course I have explained everything so nicely, so you all can score, and everything is there. If you are weak in some particular topic, you can cover through this platform. So then the mastering MCQs, that's why I did a separate MCQ based revision. Again, I didn't do a separate the revision. Of course, I was not keep on telling. It was an MCQ based to score more marks, right? So to cover everything. So the thing is topic wise revision. So that's also available. And the thing is, again, I did a lot of mixed type papers, the past papers as well as the model papers. So many papers I did. So again, future also I'm doing, right? So the future classes will be free, it's right. So you can have the access. So again, guys, and also the mastering in SBA questions. So where I am going to start, I didn't start the Paediatrics program for this time batch. So the thing is, guys, so your exams are on the KDU people, you have exams on November, and Erpm people end of November or early December. So the thing is, guys, so we have enough time to improve your knowledge. So make sure you improve the knowledge in your SBAs. If you are unable to improve your knowledge by yourselves, so join the SBA tricks as well. So it will definitely help you, because we are discussing all the tricks in the SBAs. We are asking only a particular area. So for example, Henosh Online Purpura. So there are so many facts are there. If we ask about a theory in your MCQs, we ask points. But in SBAs, we don't ask about that. We ask very few things, whether you can identify the case scenario, or whether you are aware it can cause intersusception or colitis, something like that, whether you are aware about it. So something related to that. So we don't go in detail. So hemolytic uremic syndrome. So whether you can identify the case scenario, whether you are aware with what is the most important investigation to identify the clinical condition, confirm the diagnosis of hemolytic uremic syndrome. So other than that, we don't ask anything related to hemolytic uremic syndrome in your SPAs. So it's very easy. So there are tricks are there. So how to identify? So it's not an I'm improving y'all from 10 to 20s out of 25. So thing is, it's not an like a 1 hour thing. You need to you need to learn, but you will improve, and you will be able to definitely pass, and you will be able to score very high marks. So keep that in your mind. So it's very helpful. So thing is, and also I'm doing more than 300, 400. This time I will be doing more than 500 questions of SBAs under this program, right? So you will, after doing this program, again going through this all the SBA, the more than 500, then you will be like nothing. Like you will learn everything. So good. So quickly moving to the part B things, guys. So keep this in your mind. Just sometimes they think that the technique done hari, right? No, it's not about that. So all these components are important. So the most of the time you think that the most important thing is technique. No, the most important thing is finding identification and the interpretation. The most of you all weak in that component. So that's why I'm keep on improving. Like I am focusing on those things in addition to the rest of the things. So thing is, guys, you need to perfect in each and every component. Then the thing is, guys, so keep that in mind. I also keep on telling the previous, there was a myth that the you get failed because you are unlucky. No. The reality is the people who got passed, they were lucky. The failed people was not unlucky. The past people may be lucky. Not everyone, may be lucky. Right? So keep that in your mind. If you make some significant mistake, we don't fail karanne. So there should be some sort of a significant mistake in some component. Right? Fail when keep that in your mind. So thing is, guys, so the anita average so thing is, some examiners are tough. But keep this in your mind. We like apita luck eකට හැමදේම අතට දෙන්න බෑනේ. නේද? So we need to go to the exam even if we get the worst exam and the worst case scenario. Right? To perform maximum. Right? Keep that in your mind. So then of course you will be able to pass the exams easily. So you need to improve each and every component. So the thing is, guys, so again the long case also, just you think just asking the questions and the answering. No, again the approach. care, consideration. Amma pahasuwen ඉඳන් ඉන්නවද? Amma uncomfortably ඉඳන් හිටියොත් එතනම ලකුණු අඩු කරනවා. Good morning කියන එකට long case එකෙත් ලකුණු දෙනවා. The communication skills, whether you are talking nicely. So just asking like a robot, will it be effective in Erpm exams? No, right? So you need to be nice. So that's what I improved a lot, which Tushar, like I was able to improve a lot in Tushar. So Tushar had that skill. Last time අම්මට කතා කරන්න පුළුවන්. So ඒකම polish කරා. So there are techniques are there. So which we expect. So even in your postgraduate exams also, there's something, that component is there, right? So thing is, keep that in your mind. So you need to, there's an art is there to how to communicate with the child. There's an order, right, where you need to ask. So then of course, asking the important clinical fact related to the cases within the limited time. So thing is, guys, make sure we are very concerned about the history of presenting complaint, the past medical history, and the social history in most of the cases, except the cerebral palsy and the neonatal conditions, right? And the epilepsy. So the thing is, guys, because those conditions, of course, even the birth history and the development are important. But the rest of the conditions, we are mainly worrying about the evaluating the present history of presenting complaint and the past medical history and the social history. So keep that in your mind. If you miss the social history part, again, you will get a low marks. Then the summary and the problem list. So make sure you take a nice summary. Summary is not repeating everything what mothers mentioned, right? It's an art. Then the problem list, you need to tell all the problems, the medical and the social, everything. So it's important to identify the social problems also in your social history, then you will get more and more marks. Then the diagnosis, just mentioning the febrile convulsion will not pass you at all. They will fail you for that. ඒක කියනවා ගමේ ඉන්න අප්පුත් කියනවා, right? So ගස් නගින එක්කෙනත් කියනවා උණවලිප්පුව කියලා. So we expect very much more than from a doctor. So just telling the febrile convulsion will not help you at all when you ask the diagnosis. So there are so many things to add. Just telling the nephrotic syndrome will not help you at all, right? Keep that in your mind. So you will learn everything so nicely. So then the management and discussion, you need to have a very clear idea rationally. So the thing is, I think some students actually, when they call me, they mention, and some students I think mention. So the thing is, guys, so most of the time in the management also, when they during the discussion, it's very important. If you know why it happens, then it's easy to answer. Otherwise, you will not be able to answer most of the questions. They ask why. I make it. I spleen. Sometimes they are spleen. I thalassemia ke me lamaya ke baagita spleen ke chuttat tiyenne. I liver ke chuttat tiyenne. Thalassemia, they should have facial features. Why this child does not have facial features? So you should be able to tell everything rationally. So otherwise, if you don't learn in a proper way, you will find difficult. So how to score high marks in Erpm part B and C? So the most important, as Javid mentioned, I think mentioned, highlighted this one very much. So the learn most important long and short cases related clinical facts rationally in detail. Even the Gitushan also mentioned. So without learning and without studying and without practicing alone and without just going for the patient, just going, there is a huge myth. Most of the students think that practical gihama man pass. Practical tamai hariyanne. No, not at all. You like keep that in your mind. Don't be like allowed pandita wenne pa kiyala kiyanna puluwan. So the thing is, guys, right? So keep that in your mind. Learn the facts correctly, then apply to the patient. Otherwise, as Gitu mentioned, like you are indirectly abusing the child. In surgery, of course, don't just squeeze the scrotum for the scrotal examination. Study the things and right, go for the practical. So it's very important. The children again, it's the same. You don't palpate the livers, right? Everything just right. So just see, looking. One student told me actually, like when they. So the thing is, they were preoccupied, like the Anuradhapura rickets. I think that guy is there here also. So the thing is, right? So then, of course, when he went there, this child has a difficulty in voice, do the lower limb examination. The command was that. Then, of course, Anuradhapura rickets. Then, of course, he has mentioned everything related to the rickets, then got failed. Then he came to me. So the reality is, guys, so the thing is, the case was diplegic cerebral palsy child. So keep that in your mind, guys. If you have learned everything, don't buy hard stuff. So learn things rationally, and you will learn everything nicely. So the thing is, guys, there were some previous students, right? This is at Sitna, right? So during my this is the CNS practical session in the specialized units, right? So you can see there's an quadriplegic CP child is there, right? So again, and this is again the cardio specialized units in the about the murmurs, as well as the CNS practical specialized in practicing specialized units. Again, there are some practical, these are also mixed practical. Again, this is the practice in Jayawardhanapura, this, right? And also this is the Viva exam here at Jayawardhanapura, right? So then this is emergency practical. I conducted at Late Ridgeway hospitals in the emergency setup. This was in the MICU actually. So previously in the ETU. So the thing is, guys, so again, these are some mass mix practicals which I conducted. So the thing is, guys, most of y'all saw all the patients. So this is a diplegic, sorry, not the diplegic, this is a neural tube defect who has been with an neutralized with an bilateral VP shunts, and also had all the clinical manifestations. So if you see that patient, you will be able to work up, and you will never forget features of the neural tube defect. So you can work out. The IQ child was so cute, right? That blue with a blue color trouser. Then this is an trisomy child with a cyanotic heart disease. So the child had cyanosis, clubbing, everything, and also on top of that, all the trisomy features are there. Right? This is about the development assessment. So they were right, and also there are some students who were with me, right? And this is from these. This is some pictures which I took a long time back. Actually, they gave me a party at Water's Edge. One party then on they gave me a party. So thing is, it is nice, right? So really happy. Now they are doing very well. So some are studying for postgraduates, pediatrics. So that's there. So thing is, guys, so quickly moving to the, so I want to tell, so the key important thing is, guys, if you follow and if you have proper guidance, you will be able to, right, pass the Erpm exam so easily. So the thing is, guys, before moving to the questions, so I will highlight everything very nicely and really everything so nicely in the Paediatrics program. So before, if I quickly tell you a quick summary regarding SBA questions. So when you are handling SBA questions, first of all, guys, read the answers first. So then you know what are the answers, and then okay, it's a question is very huge. So the thing is, if you read the answers, you know, this should be related to something else. So then you can, like, right, you can go to the question. Otherwise, you can again need to read the question again and again, that huge question, because like if you read the answer first, then it would be easy. Then read the last sentences of the question. That is the most important thing. So again, when you are recalling the questions also, if you change the last these sentence of the question, again, everything will get, right? Everything will be problematic. So the thing is, guys, it's very important. So whether they have asked what is the most appropriate initial step in the management, or they might ask for an example. So if they mention something related to status epilepsy or some sort of status asthmaticus, some sort of emergency, croup or epiglottitis, something like that. So they might ask, what is the initial step in the management? Or there may be anaphylaxis. What is the initial step in the management? Or they might ask something like, what is the most appropriate management of this patient? Sometimes the thing is, they might have mentioned in the case scenario, they might have done several interventions initially. They must have given 1 dose of diazepam to maybe or 2 doses of diazepam. Now the respiratory rate is this much, the pulse rate is this much, and the rhythm is this much, this way. So the thing is, again, they might ask, what is the most appropriate what is the most appropriate management for this patient? So you should be able to identify. Then they might ask, what is the next step in the management? So the thing is, again, it's also same. in the emergency, the child with an purpuric rash, presenting with a shock and with a low GCS, right? GCS is something around 5. Then of course they might ask, what is the next step they might have? Right? So the thing is, they might right? They might ask the initial step, or they might ask the next step. For example, GCS is normal, but child is in a blood pressure, everything is low. So they must have given the oxygen and everything, or must have intubated. Then they might ask, what is the next step? Right? So whether you are giving a bolus, or whether you are taking blood culture, or whether you are giving antibiotics. So again, that's very important. So keep that in your mind. So in some case scenario, of course, especially these not so common conditions. For example, 4-month-old child presented with bouts of cough and cyanotic spells. Right? So the thing is, and there's on examination, there was subconjunctival hemorrhage. Child has received routine immunization, and child's WBC is 19,000. The neutrophil levels are 20%, and the lymphocyte levels are 70%. And the platelet count is 239. So what is the most likely diagnosis? So thing is, guys, when we ask in such, then කට්ටියට click වෙනවද නැද්ද බලන්න ඕනේ. So whether you are well aware about these key points. So it's a very common case scenario. So the thing is, guys, so make sure you are able to identify the case scenario. So the thing is, guys, not so in cases like not so common as asthma, epilepsy, status epilepsy, like that, but it's little bit, it's not the conditions which are not uncommon. So they can ask, what is the most likely diagnosis? Whether you have heard about this condition. For example, if they mention child is having a fever, high-grade fever for more than 7 days, and there is on day 7, the child develop an rash over the chest and the abdomen, and there is an right hypochondrial pain and a tenderness also was there, and there is an altered bowel habits with an splenomegaly. What is the most likely diagnosis? So then you should be able to identify the case scenario, right? So keep those in your mind. So the thing is, they might ask, what is the most likely diagnosis? Sometimes you should be able to work out. So which of the following investigation would be the most useful in the reaching the definitive diagnosis? So the thing is, 3-year-old child presented with a fever and loose stools, right? High-grade fever with 102 and loose stools for 3 days duration. Then child suddenly next day morning, notice there is an reduced urine output. You can find 2 ml per kg per hour was there. And the full blood count next day morning, full blood count report shows the hemoglobin was 7 and the platelet was 88. So you all know, I think, what is the most likely diagnosis. But if they ask what is the most useful condition, right? So reaching for the definitive diagnosis. So the thing is, you should be well aware about the most appropriate investigation, right? So the thing is, guys, so it's the case scenario, typical case scenario of hemolytic uremic syndrome, but sometimes the DIC and sometimes septicemia, sometimes the TTP also can present in the similar way. So you should know the most likely condition is hemolytic uremic syndrome. So the thing is, guys, so what is the investigation of choice to identify the hemolytic uremic syndrome? Keep that in your mind, not the serum creatinine. Okay, so keep that in your mind. So which of the following investigation would be most appropriate to perform? So to 3-week-old boy presented with projectile vomiting, and there is an associated potassium, there is an associated alkalosis, as well as the potassium level was 2.3, and child was slightly icteric. So what is the most likely, what is the most appropriate investigation to confirm the diagnosis? So thing is, guys, so that is very important. So you should be able to identify the case scenario, that the case was related to the pyloric, typical picture of pyloric stenosis. So you should be aware whether what is the investigation of choice, right, to confirm the diagnosis of pyloric stenosis. It's not the barium studies, or it's not the X-ray, right? So keep that in your mind. So the thing is, guys, so then Read the question carefully and underline the important points. That's, of course, you need to do. Then identify the benign things and focus on the clinical facts rather than the social facts. So the thing is benign things. For example, guys, so sometimes the thing is they might say the child with an constipation who had fecal soiling, or maybe an associated fecal mass on the palpation of abdominal examination. So thing is, guys, so keep that in your mind. So it is not a red flag sign, right? So thing is, it's a benign thing. So it's common in functional constipation as well. So the fecal mass can get palpable in whatever the condition, whatever the constipation due to whatever the reason. So keep that in your mind. So the thing is, identify the benign things. So sometimes you might think, make all the done. Right? Keep that in your mind. And also the focus on the clinical facts rather than the social facts. So you will understand later on, right? So the thing is, keep that in your mind. And use your SBA knowledge. So we are going to learn in recent, like very soon, right? In the near future about the Paediatrics. So use that thing to apply for the Paediatrics program, right? SBS, then you can pass easily the exams. So it's nothing, right? So thing is, then you will be able to work out what is the flow and what are there are small things are there, right? It's about very CNS. It's everything about 2 pages, everything. Whole CNS, entire CNS. There are specific things are there which we are wanting because we want good house officers. So those who, you can't kill the pediatric like children. So thing is, we want good house officers. You should be able to identify as well as you need to manage. So we see the common mistakes which house where the house officers do in the wards setup. So thing is, guys, so we put those things in the question. So there are very specific things are there, very limited things are there which we put in your exams in your SBA questions. So try like when you go through this Paediatrics program process, the thing is you will be perfect about everything. So then, guys, select the most appropriate answer. So the thing is, most appropriate answer which fulfill all the clinical facts. So thing is, guys, all the answers are almost correct, but only one answer will fulfill all the clinical facts. Keep that in your mind. Just looking at one single point, don't rush, right? So keep that in your mind. So that particular answer should fulfill all the clinical facts, right? So keep that in your mind. So that's why most important answer. Good. So the thing is, guys, so I gave a paper. So can you please take that paper? We will discuss few questions. So I'm happy to see, right? So how you perform and everything. So I expect a little bit active participation. So thing is, please send me your answers through the Zoom chat. Then I will have an idea about, right? So that would be beneficial for everyone. So right? So thing is, then I will be able to explain. I can decide whether I need to explain more or not. So thing is, guys, give me a second. Zoom chat. Right. Right. So the first question, number 1. So there is a 6-year-old known child with epilepsy who had defaulted treatment, presented to the ward with persistent generalized tonic-clonic convulsion, which has lasted for 20 minutes. Child has been given 0.5 milligram per kg rectal diazepam by a general practitioner 10 minutes prior to the admission. The pulse after admission, the pulse rate is 100, the blood pressure 90/60, the respiratory rate 18, and the saturation is 95%, and the capillary blood sugar 280 milligrams per deciliter. The rest of the blood investigations are pending. What is the most appropriate next step in the management? So the IV cefotaxime, IV midazolam, IV insulin infusion, IV rectal diazepam, and the IV phenytoin. So can you send me your answers, guys? Very good, guys. So the thing is, guys, so keep this in your mind. All the answers are there. So some have answered B, some have answered, most of you all have answered B, and again, most of you all have answered C, and also the D, and some have answered E, and very few have answered A. The majority have answered either B, C, D, right? Right? So B answer karla thina, C answer karla thina, D answer karla thina. So the thing is, guys, so here the key important point is what? So thing is, so the thing is, guys, so what are the key points here? So this is a 6-year-old child with known child with an epilepsy. So this is about the status epilepsy, no? So case I told you, initially read the 5 stems. So the answers are regarding something related to status epilepsy. Obviously, when you see this thing, so it may be some sort of infection, maybe going. Hepataxim also is there, right? And the thing is, right? So the thing is, they have asked the most appropriate next step in the management. So they must have done some management partially, right? Initial management must have been done. So again, they must have answered most appropriate next step in the management for this patient, right? So this is about the status epilepsy, 6-year-old child with known child with an epilepsy who had a defaulted treatment. That's one of the commonest reason. That's the commonest reason for one of the commonest reason where they present with an status epilepsy. So the child presented with a generalized tonic-clonic convulsion, which has lasted for 20 minutes. So what is the definition of status epilepsy, guys? So the convulsion lasting for more than 30 minutes. So that's your grandfather's time, huh? So the convulsion lasting for more than 5 minutes is the definition. So the most recent definition is generalized tonic-clonic convulsion lasting for more than 5 minutes and the focal convulsion lasting for more than 10 minutes. That's called the status epilepsy, right? So if you remember the convulsion lasting for more than 5 minutes, right? So that's more than enough. So thing is, guys, so the child has developed status epilepsy. So what is the dangerous part of the status epilepsy? So thing is, guys, so if it lasts more than 5 minutes, so thing is, guys, it's very difficult to control the convulsion. So it might keep on going. So the one important thing is, guys, so that these toxic neurotransmitters will get activated and it will act as a cascade. So thing is, guys, and the more you take to treat the child, so thing is, guys, more difficult to control the seizure. So you need to act as soon as possible, as the thing is, when it goes beyond 5 minutes. So thing is, guys, at the same time, guys, when you don't treat, so with the time after 5 minutes, each minute is very important because with the time so thing is, guys, so here the thing is, I don't know whether you can see me clearly. So thing is, guys, there is something called in the brain cells, there are diazepam receptors are there, right? So the diazepam receptors are there, right? So the diazepam receptors are there. So if you don't treat it so quickly, so thing is, guys, so these diazepam receptors will down-regulate. So if it get down-regulate, so thing is, even you treat, right? Diazepam receptors will get down-regulate. So if you don't treat, what will happen? So thing is, the child might not respond at all. So make sure you start as soon as if it goes beyond 5 minutes. So thing is, guys, but do you start before 5 minutes? No. Why? The thing is, guys, most of the convulsions will get settled within 2 to 3 minutes. You don't need to worry. So definitely more than 90% of the convulsions will get settled within 5 minutes. So the thing is, guys, these drugs are very toxic, nasty drugs. So these things can, especially with these diazepam groups, medications can cause respiratory suppression. So thing is, guys, second line medications are even more toxic. So thing is, guys, sometimes these children, the drugs itself can kill the child. So you don't use it before 5 minutes, just in case if you use it at around 3 minutes time. So sometimes if something happened to child, they can go to the courts and you will find a lot of problems. Those things has happened practically, right, for most of the doctors. So that's very important. So keep that in your mind. If the convulsion goes beyond 5 minutes, only you start the medications, but you need to start as soon as possible when it goes beyond 5 minutes. But you can start the initial resuscitation with the convulsion. So this is regarding status epilepsy. So what you need to do is, guys, so first of all, any emergency, you need to manage the airway breathing circulation. So the first thing is you need to keep the child in the left lateral position, then suck out secretion, so you will be able to minimize the gastric aspiration and stabilize the airway. Then you give the high flow oxygen, right? You give the oxygen, then you assess the circulation. So most of the time, right? So you assess the circulation and you do intervention if necessary. Then, guys, what is the after managing the ABC? What is the next important thing is, guys, what? So the DEFG, or the don't ever forget glucose, or the CBS. The glucose is the most important thing. You check the glucose. If there's any evidence of hypoglycemia, you need to correct it as soon as possible, right? So sometimes following a febrile convulsion, sometimes the children are not eating. So they can go into hypoglycemia because with the fever, right? So they are not eating, so they can go into hypoglycemia. Maybe the reason for the status epilepsy is hypoglycemia. So without using any other medication, by giving and now these dextrose bolus, you can correct the convulsion. So keep that in your mind. So then, guys, what is the next important thing? You correct the CBs. But the thing is, some students have answered, has taken the answer it as, majority have taken the answer. There are a lot of students, they have taken the answer as C, or the insulin infusion. So what do you think, guys? Is it correct? දැන් මතක තියාගන්න දැන් ඔතන එක එක උත්තර දීලා තිබ්බානේ. හැබැයි කීප දෙනෙක්ගේ විතරයි උත්තර හරියන්නේ. ඒ අයට තමයි ඔය ලකුණු 5 එන්නේ. අනිත් අයට ලකුණු 5න් බිඳුවයි. නේද? It's okay, so you will improve. So thing is, guys, keep this in your mind. You correct the hypoglycemia. So thing is, normal random blood sugar level is what? That is 200 milligrams per deciliter. Now child is having 280. So are you going to give insulin and are you going to drop this? So do you think this child can goes into an hypoglycemic coma? Sorry, hyperketotic the hyposmolar non-ketotic coma, or maybe a diabetic ketoacidosis. No, guys, 280, it is something where you see practically. Most of the children will have high levels of sugars like this. So that's a common thing. So we are assessing whether you are aware about that. So are you going to give insulin to this child as the very initial management? We are worrying about that. Then most of you all have mentioned the answer is as C, or the giving insulin. So keep this in your mind. This is a very practical case scenario where you commonly notice. So why they develop this high levels of sugar, more than 200? What's the reason? So the reason is nothing else. So because of the stress effect. So there is a child is in a huge stress because of due to the stress effect. So the cortisol will get stimulated, and the thing is there will be an increased gluconeogenesis pathway, and they will have hyperglycemia. So you don't correct this hyperglycemia. If they have hypoglycemia, you need to attend, but not the hyperglycemia like around 280, not at all. So thing is, you need to control the convulsion as soon as possible. So here. So thing is, guys, so this child has received what? Diazepam, rectal diazepam, what? Diazepam. So thing is, guys, then you need to go for the, now if it goes beyond 5 minutes, you need to go for the medication. So what are the available medications? So you have first line drugs as well as the second line drugs. So what are the first line drugs, guys? Which are available? What are the first line drugs? So thing is, guys, I think most of you all have done so much of SBS and MCQs under status epilepsy, which is the most famous right topic under SBS. But right, still people make mistakes. So thing is, it's not your fault because you must have not get the concepts correct. Right, that's the reason. So if you take the concepts, I told you don't by heart. And Kia status epilepsy questions the past papers, right? So common. So the thing is, it's good to make mistakes. So here you will learn, and the thing is then you will like you don't make that mistake in your exams. So the thing is, guys, first line drugs are either diazepam or midazolam. Lorazepam is not available in Sri Lanka. No? Then, of course, guys, what you repeat the diazepam or midazolam. But keep this in your mind. We are worried whether you are well aware the maximum dose of diazepam or midazolam. So thing is, guys, if they don't get settled with by 2 doses, that means you don't go in this, you don't try in the same mechanism. Right? You go for some other mechanism. So if you keep on giving, they will develop side effects rather than this, the clinical the benefit. So they can go into respiratory suppression and they can die. Right? So keep that in your mind. Keep that in your mind. You give the maximum of 2 doses. Then what you can give either phenytoin or phenobarbital or levetiracetam. So levetiracetam is not a new drug now. Magic. It's available in most of the teaching hospitals. So the levetiracetam, of course, it's very good drug. So it does not cause either respiratory or cardiac suppression. If the levetiracetam, after giving 2 doses of diazepam or midazolam, if they are not settling, you may need to give this thing. But the thing is, guys, if it's not available in the peripheries, so then of course you may need to go for the phenobarbital or phenytoin. So again, we are assessing your knowledge whether you are well aware about the main side effect, because these drugs can kill the child. Right? So what is the important side effect when you are given a loading dose? Either phenytoin when you are given a phenytoin. So thing is, guys, the phenytoin, they can goes into arrhythmias and the hypotension. So make sure child's the vital signs of pulse rate is regular and whether these blood pressure is normal. So if it is abnormal, you don't give phenytoin. Phenobarbital. What is the main problem of phenobarbital? So where they can go, it can cause respiratory suppression. So it can cause respiratory paralysis. They can go into respiratory failure. Epilepsy control so then, of course, guys, so it can, if they mention some sort of a saturation is dropping, the thing is, or the shallow respiration, chest is not expanding too symmetrically, then of course, right, it's alarming. You don't give phenobarbital, right? Sometimes these children can go into apnea. So after giving 2 doses of diazepam, after adding a phenobarbital, they can go into apnea. These are very practical problems. So if they develop apnea, what are you going to do, Janani? Can you tell me? Unmute and tell. I think you know. That's it. I don't like to ask questions here, but the thing is, since you think you are aware, what are you going to do? So immediately you start the ambu ventilation. No. So immediate step should be there. Start the ambu ventilation. Then what is the next step? What are you going to do? Oh, you can't keep on doing the ambu, no? So the thing is, then what are you going to do? Then now assume that you are working in the peripheral unit where the ICU facilities are also not there, right? What can you do? Anyone? Imashi, do you want to add? Anyone? Can someone send through the Zoom chat? Yes, Nicola. Very good. Yes, so the thing is, guys, you can give the antidote after you need to ambu ventilate initially. Then you can give the antidote of the diazepam variety, which is flumezanil. So when you give flumezanil, so it's the antidote, so they will get cured. So if you are well aware about these facts, that is more than enough for your status epilepsy SBS. So just know initially you need to manage the ABC and the CBS. So if it is low, you need to correct it. If it is low, you need to correct it. Then you need to give either diazepam or midazolam, maximum of 2 doses. Then of course the phenobarbital or phenytoin. Now tell me, what is more important? So thing is, guys, in your exams, so tell me, so thing is now, here there are 2 answers are there. One is IV midazolam, and the other one is now child has received 1 dose of diazepam. There is something called so child have received only 1 dose of diazepam. How is the rectal diazepam make a dose? So you can go for another either midazolam or diazepam. So which one you are going to select? So right. So either whether you are going to select IV midazolam or whether you are going to select IV or rectal diazepam. So tell me, so is it difficult to cannulate in a fitting child or not? Send me an answer, yes or no. Send me an answer. Fitting fit hadena lamekwa cannulate karanda difficult than at the. Is it very difficult? Yes. Difficult to get an IV access, so good to give rectal. Difficult. Yes. No. Connect no kila. Nicola is saying no. Janani no. Chandana no. Lamai matakati aganda. So some I don't know whether from where you got that. So thing is, guys. So if you are telling, because you are yeah, of course they are shaking, no. So they are shaking. It's difficult to cannulate. So thing is, guys, helaveddi thing difficult nang kila kiyanawa nang guys, you can't have intercourse also, ne? So the people who have taught or people who are answering, so thing is, guys, it's practice. So thing is, right? Right? You must have difficulty in intercourse also, doing intercourse. So thing is, guys, so in pediatric setup, anyway, it is difficult. Like in a conscious child, it is more difficult. හිතන්න පණ තියෙන හොඳට කොන්ෂස් ඉන්න ළමයි දඟලනවා මරලා තෝනි තියෙනවා අත ගන්නවා කැනියුල එකක් දාන්න දෙනවද? Will that child be calm? So anyway, in a pediatric setup, it is difficult. But in a sitting child, it is comparatively easy, right? Comparatively easy. So if you have experience, of course, you can insert an cannula. No problem at all. So always keep this in your mind, which one route is best. So tell me, which one has more side effect? Either IV route again, the side effects are the rectal route again. If you give rectal diazepam or if you give IV diazepam, bolus එකක් දුන්නොත් diazepam diazepam IV දුන්නොත් side effects එන්නේ නැත්නම් rectal දුන්නොත් වැඩිපුර side effect එන්නේ respiratory arrest යන. Similar rectal IV rectal has more side. Lama same. So some have sent same, some have sent rectal, some have sent IV. So keep this in your mind, guys. The side effects, effectiveness wise, it is very less in rectal route. And also the side effect profile, it is very high in rectal route. Why? The thing is, guys, you are IV one, you are straight away you are giving. So you can straight away it's going to the circulation. So you can repeat the next dose in 5 minutes. You are well aware this much of dose is going to the circulation, and you know it will act very soon, and you can repeat it in 5 minutes. But the rectal route, you don't know how much it has been absorbed, right? Then again, right? So the thing is, then again you need to wait 10 minutes. So the effectiveness is less. And the other thing is, guys, you are giving the double the dose in the rectal route. So the diazepam, of course, IV route, how much you are giving? And make it 0.5 කියලා තියෙනවා rectal දීලා තියෙන්නේ. එහෙමනම් මොකද මම කියලා තියෙන්නේ මොකද දෙවියන් වහන්සේ මතක තියාගන්න ලේසි වෙන්න තමයි උගන්වලා තියෙන්නේ medicine හදලා තියෙන්නේ. So thing is half the dose. So you need to give 0.25 milligram per kg in IV. Midazolam, sublingual midazolam 0.3 milligram per kg. එහෙනම් IV නම් කොච්චරද? So 0.15 milligram per kg. So it's very easy to remember. So thing is you don't need to remember the doses in your MCQs. Not at all, right? So the thing is, guys, you are giving the hard. Just know that you are giving a low dose. Concept is that. So the thing is, guys, so they don't develop much side effects in IV route. Less side effect compared to the rectal. So always the best is IV. Keep that in your mind. So see, it's very good. Some students were not aware about that concept. So that's why I was keep on telling you will keep on doing these questions related to status epilepsy. But the thing is, the concepts are the most important. So thing is, guys, anyway, they have mentioned, so the rest of the blood investigation results are pending. So they have achieved an IV access. Otherwise, how can they? Huh? So the rest of the blood investigations are pending means, so they have achieved the IV access and they have sent the blood investigations. So when the cutting gun, the intracerebral blood gun, you can give the fluids, but you can't draw the blood. So the answer is what? IV midazolam, IV midazolam. So the answer is B, B, B. Right? Good. We'll move to another question. So the 15-year-old boy from Vallavatta presented to the ward with myalgia. So again, send me answers, right? Myalgia and abdominal pain for 4 days duration. On examination, child was febrile, icteric, conjunctival suffusion, diffuse petechiae, and severe tenderness over the calf. Calf, lumbar region, and right hypochondrial region. Pulse rate is 100. The blood pressure is 90 by 95 by 60. Give me a second. I will share this. (90 by 560). Then child had average urine output, right? 0.4 ml per kg per hour. Child had experienced an unprotected 6 months with his girlfriend 1 month back. Initial investigations are as follows. Hemoglobin 9.5, the WBC 18,000, the platelet 88, ESR 40, CRP 60, AST high, ALT high, and this is about ALP, right? ALP is 1200, and the total bilirubin is 400, and the direct bilirubin is 100. So the UFR albumin 2+, creatinine 1.2. What is the most creatinine a little bit high? So what is the most likely diagnosis? So thing is, guys, so whether it is typhoid fever, acute lymphoblastic leukemia, dengue hemorrhagic fever, viral hepatitis, and the leptospirosis. So send me answers. Very good. The majority have mentioned the correct answer, but very few have sent another answer. So the thing is, guys, yes, very good. So the thing is, majority have sent the correct answer. So the thing is, guys, so here it's very obvious, no? So they have mentioned the 15-year-old boy, teenage age group from Vallavatta, and had unprotected 6 months with the girlfriend 1 month back. So the likely diagnosis. So all the social factors are there. Likely viral hepatitis B නෙමෙයි. Right? So keep that in your mind. So don't go with the social factors. වැල්ලවත්ත කිව්වා කියලා හරි කොයි හරි හිටියා හරි නැත්නම් unprotected, right? So ඔයගලන්ගේ සමහර personal life එකක් වෙන්නත් පුළුවන්, right? So keep that in your mind. So thing is, don't go with the social factors, go with the clinical facts. So here this is a related to classic example, right? So whether you have heard about this condition. So you know there is leptospirosis, you must have heard. So this is the classical picture, guys. So the thing is, in the leptospirosis, so it's again it occurs due to the contamination, right, of the infected urine, right? So the these how the Erpm what do you call it? These carriers, right? So there are temporary carriers as well as the permanent carriers. The permanent carriers are the rodents. Rodents කියන්නේ ඉස්සරහ දත් දෙක තියෙනවා. So they have, right, significant incisors. So thing is rats, mouse, right, squirrels, rat and mouse, two different. Rat කියන mouse කියන අර posh එක. මීයා කන් දෙක round තියෙන posh එක. Rat is බල් එක, right? කන් දෙක දිගට තියෙන එක. So thing is, guys, so the right, so again squirrels, then the beavers, then districts, ඉතාව in දවස්වල කතා කරනවා නේද? So thing is, guys, again they are the carriers. So thing is, guys, like it transmitted by infected urine. So thing is, guys, keep this in your mind. So in the leptospirosis, the effect can be due to following either infection. So the thing is infection itself or the immunological manifestation itself. Immunological manifestation is also there. So thing is, guys, so the thing is these spirochetes can cause a lot of inflammation. So they can have fever, and also due to this immunological manifestation, so they can have conjunctivitis. That is very classic. In addition to that, guys, so it's very important. They also will have headache, and also the important clinical factor is myalgia, because it causes infective myopathy. That is very important. So this conjunctivitis and myalgia is very classic. So the thing is, guys, it will cause vascular, it will damage these, it will travel through the blood, so can cause leukemia. And also the thing is, guys, it will involve skin vessels. So it can cause vasculitis, so it can cause purpura, as well as it can affect the platelets. So the low platelet count is very classic. So sometimes in the practically, sometimes it's very difficult to differentiate from dengue sometimes at the initial stage. So again, it's very classic. Then of course the thing is, guys, sometimes it can involve the liver. So they can have jaundice and also the right hypochondrial pain. So in the dengue also they can have right hypochondrial pain, but the jaundice is uncommon. Then it can involve the kidneys. So the kidneys, of course, they can have, right? So mainly the acute renal failure may be with proteinuria. So the acute renal failure part is very classic. So the thing is, guys, those are the main organs which involve. In addition to that, it can involve the lungs, it can involve the meninges, it can involve the heart and cause myocarditis and pericarditis as well, which are rare. So we are worried, we are only concerned whether you are aware about these clinical facts or not related to leptospirosis. So whether they are developing conjunctivitis, whether they are developing myalgia, whether they are developing low platelets, whether it involves the liver, whether it involves the kidneys. So that's all. So thing is, guys, those things are very classic. So that's why, because so due to this myalgia, they can have high levels of CPK, right? And in the full blood count, they can have low levels of platelets. So that is there. So here again, guys, so that's very important. So the thing is, you all know the diagnosis is confirmed with microagglutination test, and the drug of choice is what? For the acute treatment, the drug of choice. Just send me the drug of choice for the leptospirosis. Not the, so most of you all have sent the doxycycline. No, guys, the doxa is for the prophylaxis. You can give either penicillin or you can go for the third generation cephalosporin. The penicillin is a better option, right? So that's there. Very good. So thing is, guys, so keep that in your mind. That you must have heard the doxycycline so frequently because that's for the prophylaxis. Of course, you can give during an acute treatment as well, but that's not the drug of choice in the initial manifestation. So thing is, guys, again, so here it's a classic picture. They have myalgia, high fever, the myalgia, abdominal pain, and the petechiae, and this conjunctivitis, and the conjunctival suffusion, and the tender cough. So due to the myopathy and the right hypochondrial pain, and the low urine output, and here the investigations are high WBC with low platelets, with then liver involvement, and the acute renal failure part. So the classic picture of leptospirosis. So thing is, guys, the typhoid, of course, they will not develop the right hypochondrial pain. They will develop right iliac fossa pain commonly because they will be an involvement of the inflammation of the Peyer's patches. So that's why they will develop right iliac fossa pain mainly, and the liver involvement and the kidney involvements are not so common. ALL, again, this is not the classic picture. They can have petechiae, they can involve the liver and the kidneys also. The thing is, guys, again, it will not cause commonly the icterus and the subconjunctival effusion. This is not the classic picture. This is not the most likely diagnosis. Then the dengue hemorrhagic fever, the icterus is uncommon and the kidney involvement also uncommon, right? Unless they have gone into a shock previously. So it's uncommon. So the viral hepatitis, just noticing the Vallavatta or girlfriend had intercourse once. So don't consider here like viral hepatitis, right? So thing is, don't go with the social facts. Go always with the clinical facts. Some students have answered it as viral hepatitis, but right. So don't go with the social facts. That's more important, right? Go with the clinical facts, right? So that's the medical student syndrome. No? So thing is, if you heard something like epistaxis, you think ITP. Epistaxis in a CL ITP නෙමෙයි. Right? Most of the time, following allergic rhinitis. So the thing is, don't just get preoccupied. So the thing is, keep that in your mind. So Vallavat is something went abroad, some sort of STD. Don't think like that. So the thing is, guys, correlate with all the features, right? Get the answers rationally. So the thing is, again, question number 3. So the thing is, guys, 18-month-old boy who developed 2 convulsions following a febrile episode. First convulsion has occurred on the day 1 of the fever, which was generalized tonic-clonic in nature. Second convulsion has occurred 2 hours later, which has lasted 2 minutes and has controlled by giving rectal diazepam by the general practitioner, which a child was transferred to the hospital, and child has developed a similar episode at the age of 11 months. During examination, there were no neck stiffness, fundus was normal, and the vital signs were normal, and the ENT examination found to have congested enlarged tonsils and left-sided inflamed eardrum. Child was treated with oral antibiotics and responded. What is the most appropriate management for this child at discharge? So the prophylactic oral antibiotics, start low dose of sodium valproate and gradually increase the dose, CT scan of the brain, and counseling and reassure the mother, and prophylactic diazepam. So send me answers. So A, C, D, C, A. The thing is, guys, I gave some very easy questions, right? I didn't want to give difficult questions. So the thing is, guys, I just wanted to show that even if I give some easy questions, you tend to make, right? The thing is, some students have marked incorrectly. So these questions are not so difficult. So these are from very common topics: status epilepsy, febrile convulsions, and even the leptospirosis. We didn't ask about the investigations or advanced of whether you have heard about this condition. That's all. So the thing is, guys, it's not a difficult thing. So the thing is, guys, so here in the question, so this is nothing else, guys. So the most of you all have mentioned A, B, C, and D, right? E වැඩි වෙලා නෑනේ. Right, I expected the answer E from, it's not the answer, but I thought most of you all will send because it's bit at least rational. So thing is, guys, here it's nothing else. This is about what? This is about complex febrile convulsion. So thing is, guys, so even it is a complex febrile convulsion. So child, what is complex febrile convulsion? So there are 3 important features are there. You all know. So most of the time it is, you don't, the complex febrile convulsion is if they develop convulsion with more than 1 convulsion within 24 hours, or if they develop focal convulsions, or if the convulsion lasts more than 15 minutes in a child, right? So it should be a febrile convulsion, right? So the febrile convulsion is convulsion occurs following a febrile episode in a child who is between 1 month to 6 years, right? Not right 6 months, huh? 1 month to 6 years. There are 6 month katawa parana ogalage 100 කාලේ. 1 month to 6 years in a right conversion occurs following a febrile episode in a child who is between 1 month to 6 years, right, without any evidence of CNS infection or secondary seizures. So if they develop an hypoglycemic conversion, then una hadila kෑම කන්න නැතුව ඉන්න පුළුවන්. So then of course we don't consider it as febrile conversion. Sometimes the like they dysentery එකක් තියෙනවා, උණ තියෙනවා, electrolyte imbalance වෙන්න පුළුවන්. So then of course we don't consider it as febrile conversion. So thing is guys, so febrile conversion is something a benign condition where some in small children where their brain is immature. So they will have hyper responsiveness to the fever or the temperature. There is no structural problem or metabolic problem, just they are sensitive for the fever. That's all. So once their brain become mature, they will get settled. So they should have some sort of a maturity. That's why you don't see children in the neonatal period. After neonatal period, there will be in some sort of maturity. Again, it is not so common till 9 months or 1 year, 9 months, right? So but can be there, right? So by 9 months, it will be they will be in maturity, but it's not so mature. So that's why they are more prone to get febrile conversion. There is a genetic influence as well as all, right? So that's also will be there. So by 6 years, so they will be completely right matured, so that they can develop maximum up to 6 years. So after 6 years, usually they will not develop febrile conversion. So thing is, guys, most of the time it will last only for 1 to 2 minutes, and it will be generalized tonic-clonic conversion, and you will notice one episode within 24 hours. But if the conversion lasting for more than 15 minutes, or if the conversion is focal, or if they are developing 2 or more conversions within 24 hours, we consider it as complex febrile conversion. But whatever it is, the key important thing, what is the main, send me an answer. What is the main problem of the febrile conversion? Either simple or fear complex. What is the main problem in the febrile conversion management of febrile conversion? Can someone send me the answer? Hypoxia to the brain, recurrency, very good, Harit. Very good, Hasini. Yes, very good, Kesar. No. Lamai Matagatiaganda, some have sent epilepsy converting to epilepsy. Matagatian key features. This is very common. So at the moment, like it is seen in 3% of children. That is in Sri Lanka, there are more than around 60,000 children are there who are vulnerable to develop febrile conversions. So the thing is, it's very common. But the thing is, it's a benign. Right? So the thing is, it will not damage the brain, and it will not cause, right? It will not cause damage to the brain, and it won't later on they won't develop the epilepsy even. The reasons recurrence is there, but the recurrence also uncommon. So the recurrence risk is usually you will notice in 1/3 of the children, right? But even the thing is, guys, it's a benign if it get recurrent. But the children who develop complex febrile conversions, they have a little bit higher risk, is little bit more of developing another attack. But again, it's a benign condition which will not damage the brain. So the thing is, guys, so even the thing is, the main worry is what? The parental anxiety. Amma bayai, amma natande. So the most of you all have sent wrong answers. So the important thing is, guys, what? Amma nataddi oya dostara vidihata natuwat hariyanawada? No. Amma natuwa kiyala oya natanna ඕනේ නැහැ. ලෙඩා පිස්සු වුණා කියලා පිස්සෙක් ආවා කියලා දොස්තර පිස්සෙක් වෙන්න පුළුවන්ද? බෑ. හරිද? So keep those things in your mind, right? Psychiatric කරද්දී ඕක ප්‍රශ්නේ සමහර විට right in your future you might experience. So the thing is, guys, you don't worry, so you need to calm, you need to be right, you need to know the exact condition, right? So this is a febrile conversion. So if it is not going right, it's not persisting, you don't need to worry. So the thing is, guys, it's a benign because the parents are keep on asking us, doctor, scan එකක් කරන්න බෑද? ඔළුවේ CT එකක් කරන්න බයිනවා සමහර මුකුත් කළෙත් නෑ. නිකන් ගෙදර යවුවා. So thing is, guys, the reality is what the CT, if you arrange a CT scans, most of you all have sent the answer, CT scan of brain. So how much radiation you are exposing for this benign condition? And will you be able to identify a problem in the CT scan of the brain? No, not at all. So you consider about the imaging study, either EEG or CT or the MRI, if they have associated microcephaly, macrocephaly, right, or the neurodevelopment delay, or these neurocutaneous manifestations, that's all. Otherwise, you will never, right? You don't need to consider about the imaging studies for these benign conditions. So don't waste investigate the resources unnecessarily. So it's a benign thing. So the thing is, guys, you need to, of course, the mothers are really scared and very anxious about this. So the thing is, you need to explain the mother. That's the most important thing, and we expect from y'all to, right, advise the mother properly. Right, since it tell that this is a benign one. So thing is, guys, it's very important that's there. So thing is, guys, so if you start, so sometimes the parents might ask, of course you can give sodium valproate and it will be effective. But the thing is, guys, sodium valproate, are you going to start sodium valproate? No, sodium valproate per se can kill the child. So it can cause liver failure. Right, the carbamazepine can cause severe side effects like Stevens-Johnson syndrome. Right, so thing is, why are you going to start dangerous drug to these benign conditions? No, so you don't start prophylactic like sodium valproate or anti-epileptics at all. But sometimes you might consider about starting about benzodiazepine group things like diazepam, oral or rectal, or something, or clobazam, something like that you can consider. But again, keep this in your mind, guys. So those things are also not so effective, and that also can cause more harm. So thing is, guys, most of the time, guys, the febrile convulsion, they develop the convulsion with an initial rapid fever spike. So thing is, guys, most of the time we have noticed some mothers are not aware whether the child had fever prior to the admission. Doctor, why it has happened with the initial fever spike, then mothers are not aware. So thing is, guys, so it's too late. That's one problem. Even you prescribe. The other problem is, guys, what? So thing is, guys, so these diazepam cause respiratory suppression also. Right? So thing is, if you buy vela dekak tunal dunnot, so the thing is, it can be more harmful. The third one is, guys, what? So thing is, guys, it can cause drowsiness, prolonged drowsiness. So when they presented with the febrile convulsion, if they have a prolonged drowsiness, what is the other thing, the condition which you need to exclude? The CNS infection. So CNS infections can cause prolonged drowsiness. So thing is, you can get misconfused. So you can get confused. So thing is, guys, so you might do unnecessary interventions like lumbar puncture, and you do unnecessary right blood investigations. So thing is, guys, so because of that, you don't start prophylaxis unnecessarily. You can consider if they are developing very recurrent attacks, right? Recurrent attacks in a low threshold of fever, frequent attacks in low threshold of fever, you can consider. And if they ask, they have developed 4 or 5 episodes previously. And the thing is, guys, in each episode, they have developed again 4 or 5 convulsions. In a such condition, then the parents are suing. So then at first you can consider about giving prophylaxis. Otherwise, you don't consider unnecessary. You don't need to know in your undergraduate level. There are syndromes, there Dravet syndrome and everything. So they can develop very frequent attacks, febrile convulsions in a low threshold. Later on, they goes into an epileptic syndrome. They convert into an epileptic syndrome. So initially, it's difficult to identify, differentiate, but identify whether the child is having these syndromes or not. So the thing is, they present with a very frequent febrile convulsions, recurrent attacks in a very low threshold. So in such situations, you might consider, but in general, you don't. So as an house officer, the key point is, guys, what? It's a benign condition, benign, where you don't need to worry about these, right? These benign conditions unnecessarily. So amma natana paliyata natanne naha kiyana fact එක තමයි වැදගත්ම දේ. So keep this in your mind. So thing is, guys, so here in the question. So they have mentioned so prophylactic oral penicillin. So some have answered. So thing is, guys, this time child had developed an otitis media, maybe associated with an so ENT if there is an connection with an eustachian tube. So thing is, child has a congested tonsils also. It's not, they haven't mentioned it's inflamed. So thing is, guys, so right. So it's one episode of tonsillitis. You don't need to consider about tonsillectomy or prophylactic penicillin. So prophylactic penicillin is given for the rheumatic fever, right? Not this, right? So the thing is, it's not the answer. Some students have sent the answer like A. So never B, right? Sodium valproate. Most of the students have sent B also. Again, it's wrong. The thing is, you don't give sodium valproate for the benign condition. Again, the CT scan also wrong. So it's a benign condition, right? So unnecessary radiation exposure. So right. So in a small, right, in these immature children, their brain is immature. So you are exposing unnecessary for the radiation. So the prophylaxis diazepam again, no. So the counseling and reassure the mother, counseling and the reassure the mother. So you need to counsel the mother properly and reassure regarding the condition. So that's the most important thing. So I think, hope you all got the point, right? So these SBAs are from the common topic, very common topics. But the thing is, guys, if you keep on make mistakes, so I just took some very easy SBAs, right? Without right thing is like, otherwise you can get depressed in the initial lecture. So thing is, guys, so if you are not well aware about these things, so thing is, guys, so thing is, if you don't get the concepts, you can get failed in your exams, because if you don't score high marks in your SBAs, you are unable to, it's difficult to pass the exams. Definitely you are unable to get high marks, and it's difficult to pass the exams as well. So the key this in your mind, you need to know the concepts and right, answer the things rationally, right? So you will learn everything in your future with this Paediatrics program. So thing is, guys, learn everything rationally. So thing is, guys, so few things to I will do the rest of the questions tomorrow. So I sent a link, and you will be added to a separate WhatsApp group. And the thing is, you will be able to access the future classes regarding MCQs and SBAs, which I'm going to discuss weekly questions, right? So you will not lose the touch, and also you can later on, once I publish the notice, you can, if you think you are weak in these SBAs, you can join these Paediatrics as well. It will be very beneficial, definitely. So thing is, guys, so how to study for the exams? So thing is, guys, so the important thing is, guys, you should have a long-term plan, definitely. So the long-term study plan should be there. So you know, so the exams will be on either November or December. So you have nearly 3 months, but you need to have a plan for 2 months, right? So of course you can pass if you apply this method, the Paediatrics thing, to all the subjects. So it's nothing for the part to get into in part A exams, right? So thing is, guys, so you it's more than enough. There were so many students were there last time also. They came just after the graduation. They had very few months, and they were able to pass all 6 subjects, and they were able to get through all 6 subjects in my as well. So thing is, it's more than enough to pass your exams. So if you if you think that you have a poor knowledge regarding the theory of these things, of course, available in the platform, you can have the access and you can cover. So the thing is, guys, have a long-term plan. So the thing is, you identify how many subjects you have, and how many modules are there, and how many subtopics are there. So categorize, right? So divide, and you give an equal proportion for the part A subjects, as well as you effort on the part B exams as well. Don't miss the shy, right? Keep that in your mind. That's very important. So then the short-term study plan. So daily you should have a study plan. Adda dawase mama මේ ටික ඉවර කරනවා. So the thing is, each of everyone have 24 hours. Everyone. So the Barack Obama, Gotabaya Rajapaksa, me, you, everyone, right? So thing is, everyone has 24 hours. So thing is, guys, keep this in your mind. So if you sleep 6 hours, so you can sleep 5 hours at night and 1 hour at the daytime, you still have 18 hours. So to eat and to have a bath and to have a rest, if you, again, right, to watch, like to walk here, and so you can reduce another 3 hours. So again, still you have 15 hours. 15 hours. So thing is, if you study one module, if you take time to study one module, if you take 3 hours, so you can cover 15 modules. So cardiovascular, respiratory, life, you can cover 5 modules within one day, right? If you take 3 hours to cover one module, you can cover 5 modules within one day, right? So it's important. So just in case if you have a class, so here still you have 10 hours, right? So keep that in your mind. So focus. So utilize the time. That's very important. So next important thing is, guys, so thing is you need to have a very good sleep. It's a must. So thing is loba wenna epa nidya ganna. So don't sleep unnecessarily. So thing is like sleep 5 hours at night and 1 hour in the morning, or sleep continuously at night 6 hours. I usually prefer sleeping 5 hours at night and 1 hour in the daytime, because it will fresh your mind. So thing is, guys, you know, in the brain, of course, there are like thing is it will help to function, right? It's important in function related to the memory. So thing is, guys, when you are related to the memory, there are 3 important steps are there. First one is acquisition, right? So that means introducing the new information to the brain. So acquisition is so the so you are introducing new things to the brain. So that's the acquisition. That's the important thing. Then the consolidation, right? So it should be well in your solid. It should goes in your deep into your brain, right? So that's important, right? So you need to recall it again and again also. That's why either doing papers or either looking quickly through your notes, just brushing through your notes. Then the third one is, guys, what? The third one is recall. So you need to recall. When I ask a question, you should be able to recall what you study. Otherwise, you will not be able to study. So one of the most main problem in the exams, of course, you have gone to so many classes. You have done so many questions. You have studied so many things. But just before your exam date, what happens practically is in your memory, you have this much amount of small things. You have done so many questions. You have studied so many things. But just before your exams, right? So keep this in your memory has a limited capacity. Don't study unnecessary. So focusing on so many facts, doing so many papers will not help you at all. You are loading unnecessary, because each and every paper there will be 5 to 10 new questions will be there, which will never get, these topics will never get overlap. So thing is, guys, you need to do papers, but make sure whether they are from the common topics. So thing is, you need to get, when I'm doing papers, I always highlight, keep those things in your mind. If you put unnecessary things in your head, you will never learn. You will not be able to perform well in your exams. That's important. So thing is, guys, so the thing is acquisition and the recall. So it happens during the wakefulness, but the thing is, guys, again, your sleep is very important. Otherwise, you will not be able to concentrate, and you will grasp the things as well as you will recall the things when it is necessary. So thing is, good sleep is very important. And the thing is, guys, that for the consolidation, it happens during the sleep. During the sleep, it will strengthen the neural connection. So it has proven with the researchers. So the proper sleep is necessary. So even sleeping at 5 hours at night and 1 hour, so it helps to consolidate. So what you study, so it will strengthen all the neural connection. Then you will not like, it will help you a lot. So don't be so greedy, right? So thing is, have a good sleep. So then dream about your goal. So you all should have a dream, right? So you can have a motto or something, like you can write it on your just in front of your table, right? I'm going to become the next generation doctor or something like that, right? Very nice thing. Mama Komari rank 1, you know. So I also had that vision when I was doing A-levels. Rank 1 you know, then of course I decided rank 1 when where rank 2 palani 2 it was the palani 10 you know. But again, it's important if you target little bit high, right? So right, if you target for 90s, you will end up in 80s or 70s at least. So if you target for 50s, then you will get fail. So thing is, guys, so have an right. So mama concentrate. I will not get disturbed. So have those points in just in front of your table. So every time you just before you study. So the thing is, every day when you wake up, so have 10 to 15 minutes just to meditate or just to or prayer and concentrate on that. So depending on your religion or if you believe in yourself, just meditate and focus on the things which you wrote in just in front of your table. That will be very beneficial. Still, I am doing that. Right? So the thing is, guys, keep that in your mind. And when you study, so the thing is, guys, always focus. And the thing is, as Gitushan also mentioned, keep this in your mind. You need to have a rest also. So every 2 hours, you need to have a 10 minutes break. So again, have a break. So you know that you are going to have a break. So you will be fresh. And again, also, if you can take a 5 minutes again to concentrate. I'm going to concentrate in the next 2 hours without getting disturbed. So switch off your Facebook, right? When you are studying, switch off the everything and study, right? So Facebook is, you can use it just before you are going to the bed. So don't use it unnecessarily, right? So thing is, guys, so keep that in your mind. So utilize your time. Then finally, the most important thing is, guys, study effectively and efficiently. So that is very important. So you can study the rheumatic fever node. You can take 3 hours to study. Some students, they study within 5 minutes. So keep that in your mind. So it's about the effectively and efficiently. So thing is, sometimes if you study once, so you just need to look at the things, note, so you can quickly with the picture memory, you can grasp. So Gitushan also mentioned, so if my rheumatic fever note is just even how much it is big. So I haven't put the pictures and everything. So it's very easy. Febrile convulsion, only one side. So it's very important, right? So keep these things in your mind. So then, of course, you must have learned in the like you are well aware about these tips, and these most of the students also, previous students also mentioned how to study for the exams. But keep these in your mind. Have a long-term study plan and a short-term study plan, and have a good sleep and dream about your goal always, always, always. Right? And also study effectively and efficiently. So that every second counts. So the thing is, guys, so that's all about the today's thing. So the lecture. So thing is, guys, I wanted to highlight the key important things related to how to pass the exam so easily. So thing is, guys, so you can have access I hope you all fill that Google form. So the thing is, if you haven't, send me a personal WhatsApp message. So if you couldn't, right? So then I will share. I will give you the link. I will give you the access. So if those who couldn't fill the Google form, send me a personal message through WhatsApp. Right? Hope you all are well aware about my number. So again, join my Telegram group where I'm putting questions time to time. So you will learn from those questions as well. So I'm putting questions to improve your memory capacity. So thing is, guys, hope you all hungry also now by now. So we'll stop for today. Hope you all have had a clear idea. Keep this in your mind. The key important thing, the main message is one: the Erpm exam is easy and the pediatrics is extremely easy. So we'll stop for today, guys. So then see you. Have a nice day. So see you guys. Have a nice day. Those who want to, if you have questions, you can stay and ask. Yes, guys. So students who have questions, you can unmute and ask. So in Febrile conversion, do we give to repeat the same dose, same drug in the first step? In the first, your question is not so clear. Miss C lecture will be in next week, right? So tomorrow I am finishing this paper, and the next week I will be discussing this Miss C one, right? So Danushka, can you unmute and ask? So your question is not so clear to me. It's okay, you can unmute and ask.
So my question is in febrile conversions, in the first step we said like if the patient is coming from the home, so anyway it's still the conversion we take as more than 5 minutes we treat the patient. If the patient is in the hospital, if it is if we can observe the patient, if it is more than 5 minutes, yes, we can treat. In first steps we treat the patient using diazepam or midazolam. So if we don't have is it necessary to always treat the patient in the first step 2 doses what we used initially? We try to give diazepam or midazolam first.
Yeah, yes, it's like this. The thing is, Danushka, so that you can use either diazepam or midazolam. The effectiveness wise, the both are same. So the thing is, initially you need to manage the ABC and the CBS. Then, of course, if it goes beyond 5 minutes, you need to give the first line drugs. The first line drugs are has a less side effects comparatively. So you can give straight away the dose. So thing is, IV straight away. You can give the dose quickly. You can push it. Pushing. So thing is, Danushka, so the either diazepam or midazolam is okay. So the effectiveness wise same when you are giving intravenously. But the thing is, midazolam has less side effect profile comparatively, little bit less. So it, of course, it also can cause respiratory suppression. But the thing is, it's less. So if they mention both answers, IV midazolam and IV diazepam, you need to go for the IV midazolam because since it has a less side effects. So thing is, you are asking, I know you are asking whether why can't we give IV phenytoin or phenobarbital without giving the second dose of diazepam or midazolam? No, I think that's maybe your question, no? So
no, sir. The thing is, my question is, we initially started diazepam or midazolam. Then if it is failed, we have to repeat it, no, sir. Yes. At least 2 doses, no. So
yes,
once we started, once we started diazepam, is it necessary to repeat it? Again the diazepam?
No, it's not necessary because the thing is, you are giving. It's diazepam and the midazolam both are in the benzodiazepam group, right? It's in the same drug category. Benzodiazepam group both the diazepam as well as the midazolam. So midazolam, which has it's a short acting one as well as it has a less side effect. Diazepam, of course, it is a long acting one and it has little bit more side effects, mainly the respiratory suppression. Right, and the drowse. So since it is long acting, it causes more drowsiness also. So thing is, so the action or the mechanism of action is almost equal. So that's why it's not necessary to repeat the diazepam again, right? If you give the first dose of diazepam, it's not necessary to repeat the diazepam. You can give the midazolam, right? Are you clear, Danushka? I hope you are clear. Yes. Okay. He has replied. So, any other questions, guys? Any other questions? No questions. Right. Then, guys, we'll stop for today. Right. So, hope you learned a lot of facts. So, then we'll stop for today, guys.